questions and the challenges I'll be raising really apply across the board. Now, as Pooja said, no conversation about mental health in the context of COVID-19 can escape first talking about the immediate, mental health challenges that people are experiencing during the crisis. And here I've just listed some of the very common mental health experiences that I suspect every one of us on this call has experienced at some point or the other, as our governments have had to respond with the growing numbers of people who have been infected and who have been dying, and have progressively been imposing more and more restrictive policies such as physical distancing, and of course in many of our countries, various degrees of a full lockdown on social and economic life. And so these particular emotions are not unique to any one person. They certainly describe actually the emotion that I myself have experienced. Not so much panic or fear, because I think in many ways I was able to read through the various numbers and understand as an epidemiologist what they really meant. And I'll turn to that in a moment. But certainly a lot of anger. Anger that sometimes policies were being thrust onto populations without a proper engagement of that population, without proper planning, and also sometimes that some of the actions that the state should have taken were not taken, and instead a much more coercive and restrictive policies were put into place. Now, that said, these are very common emotions, and I would be very loath to actually medicalize these, but instead I would suggest that there are many more community-oriented, empowering techniques and actions that we could be taking to actually manage these sorts of mental health experiences, and I'll speak about that in a moment. I think these reactions are therefore perfectly understandable in the context that we're in, which is why I said we should be medicalizing them. Here I've listed 4 different factors that I know are playing out in India, which I think are particularly germane to understanding these emotional reactions. First of all, the inaccurate messaging. So for example, the fact that this is a disease which is particularly lethal only in older people has never really been properly communicated. So that everyone in the population, and mind you, India is a youthful population, only 1% of India's population is aged over the age of 75, which is the age group in which most of the deaths have occurred around the world. Yet, of course, the inaccurate messaging of risk, the age stratified risk factors are simply not present, and therefore people have generally felt that this is a disease of very high lethality across all age groups. The second, of course, is tied in with this is the Gaulish reporting every single day in our newspapers. There's a kind of a chart that appears that shows how many people have died every day. And, you know, the interesting thing is, of course, that altogether in the last couple of months, about 400, unfortunately, 400 people have died. But during the same period, several million people have died of all kinds of other causes, so that the actual relative contribution of this infection to overall mortality is less than 0.1%. And again, this very fact that yes, this is a deadly disease, but it is actually no more deadly or less deadly than any number of other conditions that are killing people all the time. The third, of course, is in spite of these relatively low lethality factors, there's been such stringent historic action with very little warning and no precedence in our history. And I think, again, this scares people, right? I mean, imagine, you know, people are accustomed to death in India, and yet there doesn't seem to be any urgent action to control any other cause of death. Well, it's natural that people will feel very fearful when such a action is taken where 1.3 billion people are put under a very stringent lockdown with just 3 hours of warning to prepare for it. And then, of course, the loss of freedom and employment that has affected people all around the world, which has great impacts on our mental health. Now, there are many different people who are suggesting different kinds of sources of information on how we can address our mental health. And I'm sorry if this slide isn't all that clear, but this particular slide comes from the Interagency Standing Committee, which was formed many years ago for a variety of different UN and global agencies to prepare a set of recommendations on how to address mental health in the context of humanitarian crises. And I think this particular framework is actually quite relevant in the context of the global COVID-19 pandemic, because there are many similarities with a humanitarian crisis. For example, the massive numbers of people who have essentially become unemployed overnight, And in the case of India, for example, the tens of millions of people who have found themselves on the move, migrating away from their urban homes where they've lost their jobs or where they've been locked down, trying to return back to their villages around the country. Now, as you can see, this is the classic pyramid of care, where the pyramid is broadest at the base, which represents the community, the foundation of any mental health care system. And then as needs become more extreme or severe, you can see the pyramid narrowing at the top. And that reflects, of course, the more specialized mental health services at the top of the pyramid for people who have frank mental health problems. But if you had to ask me, what part of this pyramid is most relevant in the context of a humanitarian mental health, I wouldn't use the word crisis, but these distressing experiences that are sweeping across the community, I would suggest that it's really at the base of the pyramid. Here, as I've shown in the circle, strengthening community and family support systems, and of course, social considerations. And I think this is extremely important, and I'll come back to that later on. One cannot consider mental health as being separate from one's social well-being. Just to medicalize mental illness is really only seeing mental health from a microscopic point of view and missing the bigger picture of mental health. Our mental health and well-being is inseparably connected to our social world, our social well-being, and indeed also to our physical health. And therefore, addressing those social determinants, particularly at the population level, is, I think, of central importance. What does that mean? It could mean anything from ensuring that people are able to get back home, that public transportation is available for them, to ensuring that no one goes hungry by having emergency food supply systems in place, and addressing, obviously, as I'll turn to in a moment, the longer term concerns about economic livelihoods that is affecting such large sections of our community. Similarly, another example might be reaching out to those populations that are particularly vulnerable to physical distancing, such as older people who are living alone. In fact, anyone who's living alone, but in particular older people, because of course this is a group that also must feel particularly threatened by the fact that this virus's greatest lethality is in the segment of older people. So I want to leave this acute crisis behind now, and I want to turn to really the title of my talk, which is The Deaths of Despair. And I think this really is about what is likely to happen, not only as the crisis continues, as we've begun to recognize that this crisis is not going to disappear the moment lockdowns lift. In fact, what the lockdown has really effectively done in most countries is to kick the can down the road. And this is, of course, because the lockdown doesn't kill the infection. What it does is it simply delays the surge of infections. The only way that we will ultimately defeat this infection is when a vaccine appears, and that might be not for at least a year and a half or so, or as the infection gradually spreads across the community and you acquire what's often called herd immunity. And that can only happen actually when people are exposed to the infection. And so as long as you have a lockdown, you're actually preventing the inevitable, which is the gradual exposure of the population to the infection. So this crisis is going to continue for quite a while. But while it continues for quite a while, that is the infection crisis, there is another crisis that is now beginning to loom. And that is a crisis of massive unemployment and the loss of livelihoods on an incredible scale. Mind you, this is not only going to affect the poor, but it's going to affect everyone. But obviously those who live on the breadline already, those who live day to day, are those who are going to be affected even more severely than people like myself who already have secure jobs in a university setting. Now, some of you may wonder where I came up with this, this title, The Deaths of Despair, but it comes from a classic book that I think has been incredibly influential. Angus Deaton, who won the Nobel Prize in Economics, he's a professor of economics in Princeton, and his colleague Anne Case wrote this book, The Deaths of Despair. And what they were really referring to is something quite different. They were really referring to the epidemic of premature mortality that has been witnessed in the US as a fallout of the 2008 economic recession. And most of these deaths were, they used the word despair to really indicate that they were not talking about deaths due to poverty, absolute poverty, in the aftermath of the recession. So these were not people dying of hunger, but these were people who were dying because they had lost hope. They had lost hope in a future in which they would be gainfully employed, where they would be productive members of the communities that they were part of. And so that's why the word despair is very important. These are not deaths of hunger, which of course are a big concern in India, but this is more than just absolute poverty. This is the death that occurs when one loses hope altogether of one's role, one's place, one's meaning in the society that one is part of. And of course, these deaths were driven in the US largely by physical and mental ill health, and in particular due to suicide, alcohol, and of course a very particular American pandemic, the opioid epidemic, that has led ultimately to a flattening and even a reduction in the life expectancy of working age Americans following 2008. Now, I'm concerned because in India, and I will suggest that this is a problem that is going to affect the whole world, that we are seeing unemployment on an astonishing level. According to this ILO estimate, the International Labour Organization of the UN, 400 million Indians, that's more than the entire population of the US, will sink into poverty as a consequence of the pandemic. And of course, if you think of the numbers of people beyond those 400 million, their household members and so on, we're talking about an astonishing proportion of India's population. And so it is a matter of grave concern when one considers that this is a double whammy for this population. Not only is this population having to deal with absolute poverty, for example, going hungry because there's no food on the table, but also the loss of hope, because there is no real signal of when the economy will return to normal. And of course, therefore, there is a prospect of people being unemployed for a long time. This is a kind of a cycle that I had drawn up in 2003 to demonstrate the cyclical relationship between poverty and mental ill health. And of course, it's equally relevant now. Poverty through a number of different mechanisms, such as listed on this slide: hunger, exclusion, lack of basic material amenities, and so on. But also I want to point out the last point, which I think is extremely relevant, the increase in violence, particularly gender-based violence, that is already being reported around the world, where women are being trapped in their homes with violent spouses or partners, but they can't escape. And of course, many of the services that are catering to women who live in such violent relationships have also been locked down. And so these are all kinds of different mechanisms through which poverty affects mental health. But of course, one thing that I haven't mentioned on this slide is the kind of despair that happens when as I mentioned earlier, when one simply loses hope in one's future. And then that mental ill health, through a variety of different mechanisms, slides you further into poverty. For example, people with mental ill health often suffer a range of other physical morbidities, such as aches and pains and sleep problems and so on. And that in turn leads to increased health expenditure. Of course, when you're not feeling very good about yourself, paradoxically, you're less able to work effectively and you become less productive. And so you have this kind of vicious cycle that we might see, in all likelihood, in the months ahead. Now, I want to finish off by thinking about the context of the mental health care landscape in India, in which this particular, what I consider an even more scary epidemic will unfold in the months ahead. And that is, of course, India's national mental health landscape that existed even before COVID-19 hit our shores. And I think the best place to start is to look at the National Mental Health Survey that the government of India had launched some years ago now, and the report that was published about 4 years ago. And I think this particular report is extremely relevant to refer to for two reasons. First of all, because it provided for the first time an accurate national estimate of the burden of mental health problems in adults across the country, and reported that about 10% of all adult Indians, 10% of all adult Indians, which numbers to nearly 100 million Indians at the time of the survey, were identified as having a mental or a substance use disorder. That is already an astonishing number, even before we had the COVID-19 pandemic. But what is also a very important finding of the survey, and this is the second important headline finding, is that the vast majority of these people, if you consider here this figure of mental health problems, 85% of these people had not received any care in the previous 12 months. And if you break down these mental health conditions into mood and anxiety problems, what are called common mental health problems, or serious mental health problems, such as the psychosis, you can see that the proportions not receiving any care, even for the most severe problems, was hovering at 75%. So not only do we have an enormous pre-existing burden of mental health problems, but the vast majority of these people who are affected have not been able to access care in the previous 12 months. And this is before COVID-19. Now, one of the consequences of this is, of course, suicide. And we already know that suicide is a major cause of death in India, but exactly how big a problem is it? On this slide, I want to draw attention to data that was published only last year on suicide mortality in India. And I want to show you how the proportion of deaths due to suicide in the world that occur in India has changed between 1990 and 2016. This is the figure for men. In 1990, about 1 in 5 of all men who committed suicide were Indian. This proportion increased to 1 in 4 in 2016. The proportions for women are even more staggering. Whereas it was 1 in 5 or 1 in 4 in 1990, 25 years later, 1 in 3 of all female suicide deaths in the world were in India. Now, many of you may wonder, well, that probably reflects the proportion of men and women in the world who are Indian, because India is the second most populous country in the world. Not quite, because this shows you the proportion of men and women in the world who are Indian. And you can see very clearly that that hovers around 15%. So the point in this slide is India is already disproportionately accounting for a much larger share of the global number of suicides. Another very peculiar, yes?
Didn't mean to interrupt you. Is it possible to zoom your slides a bit? They're not really visible on the phone. Is it possible, or is it already in the slideshow? So
it is in slideshow, unfortunately.
Yeah,
Is it because you can see the other slide as well? The next slide?
No, I'm just talking about the main slide. I just got a message. But
no,
carry on.
Unfortunately, this is the best I can seem to make it on the Zoom window. Let me see if I can look at the display settings and make it a little bit bigger.
I don't think you can. No, I don't.
Unfortunately, that's the best it gets. Anyway, I'm coming to the end of my presentation, and there are no more detailed slides, and so hopefully the people are struggling. I'm going to speak out the slides. There's just a few visuals that follow, and then I'm going to come to an end. The other peculiar thing about suicide in India that's worth remembering is that most suicides occur in younger people. And this is why this is relevant. This is relevant, as you can see on this slide, for men and women across these two different age years of 1990 and 2016. The real peak of suicide is occurring here during the ages of between 15 and 40. And of course, this is really relevant because this is the age group that is most affected by the pandemic. This is the age group that has lost employment. This is the age group that is moving in biblical numbers from the cities back to the rural areas. And so this is the age group that we should be most concerned about when we think about the epidemic's consequences on suicide. The concerns about suicide are not just as conjecture. Already we know from work in Hong Kong that suicide peaks during epidemics, and this comes from a paper that was looking at suicide mortality during the last coronavirus epidemic, which was a SARS epidemic in Hong Kong. Suicide rates increased by 30%. And in this particular instance, this was a study for older people, but there were similar peaks also seen in younger people. And only last week in America, colleagues from American academia predicted a perfect storm of suicide and the coronavirus in the years ahead. And this is in the US, of course. Now, I want to end by thinking of opportunities. Really, the most important opportunity we have in India is that there is political will at the highest level to address mental health. Pooja mentioned, India's national mental health policy that I was involved with drafting. This is on the left-hand side is the cover of the national mental health policy. But of course, a policy is only an aspirational statement. What we really need is a legal instrument that entitles people to mental health care. And on the right-hand side here, you can see the cover of indeed India's Mental Health Care Act, which is a revolutionary development in our country because there is no such act that entitles people to any form of healthcare. This is the first legal instrument that entitles Indians to healthcare. And interestingly, and perhaps fascinatingly for some of us, the disease area that was chosen was mental health. And so in many ways, India's people are now entitled to mental health care. But of course, there is a huge challenge. The challenge is we have less than 10,000 mental health professionals in a country of more than 1 billion people. Most of these professionals are concentrated in urban metropolitan areas, and more than half of them work only in the private sector, which means that vast swathes of our population will not be able to access mental health care. And this is where perhaps the most exciting opportunity comes into play. And this is the ingenuity of India's civil society and implementation scientists who have shown over the last 10 years the incredible effectiveness and power of non-specialized providers such as community health workers called ASHA workers, but a variety of other kinds of non-specialist providers, peer providers, nurses, and so on, in delivering psychological and social interventions in community settings. And in Q&A, I'm happy to answer more about that. But suffice to say that right now, there is no longer any doubt that this is an incredibly effective and powerful way of getting mental health care, particularly the psychological and social interventions that are going to be so important as we try and prevent the deaths of despair out into the community at scale. And this is my last slide. It really summarizes what I think are the critical actions that we're going to need in the weeks and months ahead. The first is a very quick restoration of the economy and social life. And I'm really relieved today to see some of the specific guidelines on how the lockdown will be lifted in a staggered way. I think these are exactly the right things to see happen. I hope very much, though, that one of the key things that we see happen very quickly is a restoration of public transportation, because the poor in our country rely on public transportation for everything, not only to get back to their homes, but to get to hospital, to get to healthcare, to get to work. And so a restoration of public transportation and a restoration of social life as early as is feasible, I think must be an imperative. And this is, of course, a profoundly important mental health interventions as well. Secondly, during this period, a proportionate and rapid response to the livelihoods of those who've been affected. A rapid response would mean, for example, just identifying people who've lost their livelihoods and ensuring that they have direct cash support as soon as possible. Again, this may sound like an economic intervention. Yes, it is. But again, it is a mental health intervention too, because this is going to be profoundly important to support people's well-being. We need to make sure that our media and the government are reporting the epidemic in a factually accurate way and in a balanced way. I find it very disturbing, for example, when you see these spikes of numbers, which is terrifying. But of course, what people are not telling you is that those numbers reflect the number of tests that are done. Think about it. It's such a simple point. If you don't test anyone, you'll have no cases. It's just a simple rule of thumb. The more you test, the more you'll find. And so those numbers don't mean necessarily that the epidemic is sweeping across the country. They may mean actually that you're being more effective in identifying those who are infected. And so, simply reframing these numbers in a way that doesn't seed fear and panic, I think is an extremely important goal. And finally, when I have to think of a particular mental health aspect to the intervention, I would put all my money behind the scaling up of community health worker delivered psychosocial interventions. We know what those interventions are. We know that how they work. We know that they do work. And we also know what the means must be to skill up India's mental health workforce very quickly, particularly using digital platforms for training and supervision and delivery. And I'm very happy again to talk about those if there are questions regarding that. Yeah. So I'll pause there and hand back to you, Pooja, for any questions you have or anyone else has submitted online.
Thank you, Vikram. I think there are some, very interesting points you raised specifically about what government is really doing. The ASHA workers. In fact, there is a helpline which they have started. It's a toll-free helpline where people can call in for, if they're feeling any mental health concerns. What would be some of your suggestions around innovative ways, or probably use of technology, as you were mentioning, which can address these? Because mental health is still a stigma in India, unlike West. So initially there is a need to put a spotlight on that, people have to talk about it, and then only it can be addressed. So probably these are two separate questions. One, what are some innovative ways to address this? And two, how do we bring the spotlight in the east side of the world to really talk about it first, because so that people don't see it as a stigma?
Yeah, sure. So first of all, you're right. Mental health is stigmatized. It's stigmatized everywhere, Pooja, not just in India. But I do think stigma is reducing. It's reducing dramatically. The very fact that India's government has actually got a mental health care act. Our MPs are, members of our community, and the fact that there was bipartisan agreement on it, it suggests that actually there's been enormous reduction in stigma. The fact that there are these helplines. I mean, I couldn't have imagined 20 years ago with an epidemic, there being so much conversation about mental health. So to be honest, stigma is reducing. There's a huge demand for these helplines. I understand the NIMHANS helpline has already attracted tens of thousands of calls. So I think people are using the helpline. I think the question is, how much can a helpline achieve? And I think it can do some initial screening of people, giving simple tips for self-care, which I think is extremely helpful, but it cannot provide treatment. A helpline is not a treatment platform. It's an advice and guidance platform. It's a triaging platform, place to give people advice on where they can go. And this is where we really have a problem. Where do you go to seek care in a lockdown phase? And I think for that, what we need is a skilled workforce that can provide evidence-based psychological interventions in the way that we're doing right now using teleplatforms. So for example, Zoom or any other teleplatform, the government has many teleplatforms of its own, or even telephonic counseling is the need of the hour. But that said, we can't just use counseling as a black box. We need to make sure that what people are delivering is in fact an empirically supported psychological therapy. And again, as I mentioned earlier, we know what those therapies are. They've been developed and tested in India. What we now need is to scale those up as quickly as possible.
Yeah. So in terms of scaling, that brings me to, in fact, other, couple of other speakers who are talking. There's a young guy, Siddharth, who's going to speak about the piece which youth is bringing in terms of solving the scaling up problem, as you're talking about. What do you believe, could be the schools or the corporates or the entrepreneurs or the startups could be doing to help scale up? Because we'll need a massive scale. And you're right, it's not only the initial advice, it is the skillful labor which is later needed as well. So what's your perspective on the role of those entrepreneurs, those corporates, or even schools for that matter in this aspect?
So let me say one thing, I think you touched on a very important point. One of the biggest impacts of this pandemic is going to be massive unemployment.
Yeah.
And yet at the same time, there's going to be an enormous need for care. And I can see that a thoughtful policy would be connecting the unemployed with the need for care. Because here we have a ready, unemployed, youthful, motivated workforce. Here we have a need. And the important thing is that the need can be met through very scalable and available technologies. This is not about sending people into doing a PhD at a university. This is about learning brief psychological therapies. We've developed, for example, a brief treatment for depression, which is a 6 to 8 session treatment, very well tested, published in the world's best medical journals. And now we're scaling up in Madhya Pradesh and we hope in Gujarat, using a platform called Empower, which is intended to actually digitize the learning of this treatment using an entirely video-based curriculum, followed by a validated competency test, which is also deliverable on a digital platform. And then we need resources to actually develop the delivery tools so that once you become trained and you're competent, you're able to then be supported in how to deliver the 6 to 8 session treatment, either remotely or when finally the lockdown lifts in person. Because remember, the lockdown isn't going to be here permanently. So I think at some stage, we will begin to return back to face-to-face contact. And of course, most of us really do enjoy face-to-face contact. That's the way we feel. Most of our healthcare will, in fact, be face-to-face. So ultimately, that is the kind of scaling up that we need. And so if you ask me a question, what should philanthropists do? I think they should look no further than the science that already exists, a homegrown science in India. And I wanted to touch on one more thing, which maybe people are not aware of, is that this homegrown science is also being rolled out in the world's richest country, which is the US. So the same idea of Empower is being simultaneously built, not only to actually skill up the workforce for mental health care in India, but it is also being used simultaneously in the US. And this shows you the power of science, that the same science here, in this case, developed in India, is actually got a value even in other parts of the world. I can't imagine how often that has ever happened, where a frugal innovation using community workers with brief therapies has actually been translated and is now being adapted and adopted in a very wealthy country.
That is phenomenal. So that brings me to another point, that this dots, we are connecting these dots, and again, the massive size of the country we have right now. How do we ensure that what these small innovations which are happening in the NGOs like one which you're managing as well is really plugging back to the mainstream government as well? Is there a loop which you have as well, which is plugging it back to the mainstream India?
So, I work with an NGO called Sangat, which is headquartered in Goa, but has hubs in Bhopal and Delhi. And so we have always had historically a philosophy of working with government. So, Sangat has never really tried to create a parallel service. In our mind, the really important, the important sort of goal of an NGO, particularly I think in India, is to really strengthen the hand of government, to develop innovative ways of delivering interventions through the public system. So for example, in Madhya Pradesh, we work with the state government. In Delhi, we work with the state government. In Delhi, in fact, it's interesting, the approach we're using of using community health workers is being used to deliver autism interventions through the ASHA workers of Delhi government. So the idea really here is that there is a workforce that is already in place. But I agree with you that we have to look beyond the government workforce. And I think in the context of massive unemployment that you mentioned earlier, and the real interest and desire of young people around the country to learn psychological therapies. They've been put off so far because they've always been told you have to go for 10 years of high education and you've got to become a psychologist or a psychiatrist. Yes, that is true if you want to be a mental health specialist. Yeah. But if you only want to learn a specific skill of providing a specific treatment for people who are depressed or anxious, you don't need that. And that is the kind of incredibly disruptive but exciting innovation that is already available.
Yeah, and in fact, there are a lot of mental health chatbots which have sprung up in I would say last 1 year or so. I don't know if you have a perspective on that. And they're exactly targeting that. They are not, trying to solve the entire thing, but they are, saying that, all right, there is a sleep disorder. There is an anxiety issue.
Correct.
Can I do an initial triage just by asking some very nice reflective questions and give some tools? And that itself, unlocks the person, and they're working. So I would totally agree with you on that. Another
so exactly right, Pooja. So I just wanted to respond to that. You're absolutely right. In fact, the technology revolution in mental health that started more than 10 years ago was really around addressing the lack of skilled providers by preparing apps and other tools that people could use for self-care. And you're absolutely right. If you can actually use those kinds of technologies for self-care, and we now know that with adequate support, those self-care tools can be just as good as actually receiving therapy, then obviously what I'm talking about is, is just a natural extension of that. That said, let me tell you something important. In the real world, if you were given a choice between an affordable human provider who can deliver treatment that is accredited, that it has scientific foundation to it, or sitting in front with your phone and plugging away when you're depressed, I think you can just imagine in your mind, what would you choose? And of course, we know the answer is most people would choose a human provider. And so instead of just leapfrogging the human provider, because we lived in that kind of idea that human providers had to have PhDs and MDs, what this new science shows is no, human providers can be just community-based workers, even lay people, with a structured training program, competency assessment, and appropriate supervision and support. It is perfectly possible to have the base of the mental health care system. If you remember that pyramid I showed, the foundation to be led by these community-based workers.
That is awesome. I want to just draw your attention a little bit towards, you know, the day to day. I'm a mother of 3 daughters as well, and you know their school is not really, they're trying to do online classes, not really happening. Then children are a little bit confused as well. In fact, I don't know if it was Poland or Finland, the prime minister called in only to address children. You know, she called in a news conference to only address children. So what do you think are some suggestions you have, or the best practices which we as parents could follow, so that our children who are sitting at home, they don't get into this cycle of, because I'll give you an example. I was following a chat of my daughter the other day on their, you know, and she is in class 5th right now. So one of the child actually mentioned that, what if my school really opens a year down the line? What if the school just doesn't open this year as well? Now that thought really intrigued me, that a child is thinking that the school might just not open, which could or could not be a reality. So they are going in the what if mode right now. So as parents, what is your advice to us as parents, or all the people who are listening on Facebook right now, and what kind of talks they can have with their children to not go into this mental spiral?
Yeah, this is of course a very important question, because often we forget that the children in our homes must also be incorporating our own anxieties, and watching television and seeing the hysterical. Some of the early reportage, Pooja, was truly so hysterical and unprofessional on the media. I remember myself being on an interview very early on in the pandemic, when this news anchor was screaming away about some unfortunate individual who had been identified with COVID-19, and she was screaming hysterically that they should arrest him and all the rest of it. You know, I think, let's be honest, we forget that there's a kid sitting next to us and watching that same screen. And I think what we should first and foremost do is to limit access to such kind of information to our kids. And for that, we have to be role models ourselves. You know, we have to ensure that that information is filtered in a way that is sensible and that is controlled. And where there are these scary and often sensationalist numbers being presented, we need to sit with our kids and explain to them the facts. Of course, that means we have to understand those facts ourselves. And unfortunately, that is a problem for many people, because these facts have been so badly presented and so incorrectly presented that oftentimes we are also confused as adults. So the first thing is really providing information in a child-friendly, age-appropriate way, and limiting television and information time. Now, the screen is very important. And I think obviously screen time, social media time should also be restricted. But again, I would say that every parent has to role model. If we're asking kids to limit their screen time, well, I think, the best role modeling is that we ourselves need to be setting examples. The third thing is routines. Routines are terribly important. For everyone. Certainty is very important for our mental health. And establishing routines around play, around studies is extremely important in a child's life. Engaging kids in home activities, for example, whatever domestic chores that you all are involved in at home, those are ways in making children feel purposeful, like they are contributing in some kind of purposeful way to the home life. So these are the kinds of things you want to be doing. And finally, not minimizing or dismissing a child's feelings. If the child is really expressing feelings of fear and anxiety, listening to the child, not rubbishing it, not dismissing it, acknowledging it, that yes, these are genuine, authentic feelings, but then trying to normalize it and trying to sort of express to the child that these are normal reactions to a very abnormal time in all our lives, and giving the child hope that these are temporary times and that they will revert to normal. And indeed, as we know from today, they are already beginning to revert to normal in stages, and that in a matter of weeks, life will return to almost complete normality. And that's a kind of hopeful messaging that we must be giving our children.
Yeah, I totally agree. In fact, there is a conversation or probably an article which I was reading about how do we define the new normal? Because, one of the aspects which people can feel that they can get trapped in is that, wish I would go back to the same normal. Would you believe, Dr. Vikram, that, people should be now defining what is that new normal for them? As in, what should they discard what they used to do earlier, and what should they add to what they should be doing, or thinking rather as well, so that they have the new normal defined?
Well, to be honest, Pooja, I don't even know what the new normal would look like for me. So I don't know how anyone can really tell what that new normal is. I'll tell you, and I'm not being joking, is that, if the new normal is not spitting in the public, being able to
Vikram? Vikram? Vikram, can you hear us? I think we
can
have
hear
lost.
you.
Yeah, I can hear you now. We are good.
Okay, sorry.
We lost you for a second.
I was just saying I don't know what the new normal is. If the new normal is going to look like being more hygienic in our day-to-day etiquettes, not crowding into one another in queues, sneezing and coughing in a hygienic way, washing our hands regularly. Well, that's a pretty good new normal to have. But I don't think the new normal should mean we should be socially distant from one another. Absolutely not. A new normal should not be that we can't go about our daily lives like we always did. Look, the world has faced pandemics like this so often before. This is not the first pandemic. Even in India alone, we've had Zika, we've had Nipah virus, we've had, actually SARS never came to India.
Yeah.
How do we deal with it? We dealt with it effectively through sensible epidemic management policies, and we got on with our lives. And I think that is exactly what we should expect with this particular pandemic. The I'll tell you, the real threat of this pandemic is not the virus. It's really the economic consequences of the containment policies.
How about the, given that the magnitude of this pandemic right now, do you think this can leave a sense of phobia within the society for years to come?
I think it will certainly make people anxious for some time to come. I don't know if it'll be years, and I hope very much as we move forward, the messaging that we get from the government and the way it's presented in the media is going to be much more balanced. It's going to be more accurate, that there will be far more positive messaging, for example, of recovery. Why is it we don't see enough stories of recovery? Why don't we recognize that actually 95 out of every 100 people don't even land up in hospital? Those kind of much more positive, spinning the number the other way around. I mean, let's be honest, if we look at the numbers are all positive, actually, that more than half the people who are infected don't even know they're infected. Think about that. Where they've been doing population-based surveys, they've discovered that 50% of people with the infection didn't even have a symptom. I mean, imagine if this number was thrown out, right? So instead of negative messaging, the positive messaging, I think, will go a long way to helping people feel a lot less phobic and anxious. That said, I don't believe that we should throw into the dustbin all the very good policies I mentioned earlier to do with hygiene and etiquette. I think those should become part of our lives always.
Thank you so much, Vikram. I think this was one wonderful perspective to hear, and I especially like the reframes, I think, and the way to look at the world. I think initially how you describe it, are we the crisis we are in, or is it a time of distress, which is temporary? That reframe itself can change a lot in a human being and how they feel, how they think itself. So these were some phenomenal insights, at least I got. I'm sure our audience would have got it as well. I want to just make sure if there are any questions. I already were taking few from the audience. I already took few. Doesn't look like that we have any more questions from the audience. And I think we're right on time. Thank you so much, for this insightful conversation, Dr. Vikram. I really enjoyed this conversation. Thank you so much for coming on time.
Thank you, Pooja. Thanks very much. Bye-bye now.
Thank you so much. And with this, we are going to be moving on to our next segment. All right. We've had some great insights in this insightful conversation we just had. We are now moving on to our second session. You already see a young, dynamic person on the screen who I'm going to just introduce in a bit. This session is going to be about youth, and I think Vikram also kind of touched upon it as to how the community is bringing together a big role in how we're going to shape up India and the initiatives we'll have. And Siddharth Sudhakaran, who you see on the screen, is the speaker of this session. He belongs to Global Shapers Bangalore, which is an initiative of World Economic Forum. It is a network of inspiring young people who are all less than 30 years of age. And working together to address local, regional, and global challenges. They are effectively millennials, but the Siddhartha and team do not like me mentioning them as millennials, so I'm going to refrain from that. He is also a Swedish Institute Young Connectors of the Future Fellow, a One Young World Ambassador. He runs a mental health nonprofit called LoanPack and works as a senior analyst at a financial technology startup in Bangalore. That's a lot for somebody who's less than 30, Siddharth. Kudos to you for that. So from the talk which Siddharth is going to give, he's going to be talking about the work they are doing at Global Shapers Bangalore. He'll be talking about how the youth are working in the area of preventive mental health, adapting to the challenges posed by COVID-19 crisis. He'll also talk about how they are addressing the fallout, which is resulting from the quarantine, like Dr. Vikram also shared, and the issues with it, and how now they're, as a team, they are pivoting. They've already done some great initiatives in the past, but because of the quarantine, they were kind of shut down. So Siddharth is going to show a light on how the world is for them in pre and post, and how they're really bringing the community together. So over to you, Siddharth.
Thank you so much for the introduction, Pooja. Thank you, thank you. Am I audible now?
Yes, you are.
And are people able to see my slides?
Yes, yes, we can.
Awesome. Yeah, a very good evening to all of you listening. And it's a great honor to be over here, and especially to talk after that amazing talk by Dr. Vikram. So without much further ado, I'll start off with what I had in mind. And like Pooja had mentioned, I'm part of the Global Shapers Bangalore team. And what I'm going to talk about is to address how the youth across the world who are working in this field of mental health, how are they responding to the challenges that this crisis has thrown, both in terms of unique mental health challenges that arise from the isolation and quarantine, also how are they adapting existing initiatives that they've had to address, to go through this crisis. So let me go first, right? Like, I think a lot of people do ask me, when you say you're a global shaper, what exactly does it mean, right? And to just briefly give you an idea of what we do. So it was born out of the World Economic Forum, the Global Shapers community, and it's a network of, like Pooja mentioned,
Sorry, Siddharth,
young
are you
people
moving your
less than
slides?
30 years of age.
Siddharth, are you moving your slides? Your slides
Yeah,
are not.
was it not visible?
The slide,
Okay,
the
just
first
1
one
second.
is the only one I see right now. Have you moved?
Just 1 second. Yeah, I have. Is it not?
It's not. So you want to switch off your video for a bit and see if it works?
Yeah, sure. Just 1 second.
Yeah.
Shall I try sharing once more? Just 1 second.
Click the bottom left arrow and see if it works for you. The bottom left arrow.
Yeah, second slide is visible now. What are the global shapers?
No, I think you're not in your slideshow. Are you in your slideshow? In your
All
slide,
right.
yeah. Click this link. Yes, absolutely. Click this one.
Just 1 second. Is it visible now?
No, it's not. You have to click the arrow which is on the right. We have lost Siddharth, is it? I think we have lost Siddharth. We're going to just give him a minute or so. Sorry about that. Can we put something up? I can actually do the slides myself. Let me pull that up. 1 second. All right. Siddharth, let me share my screen. I have the slides. I think it'll be easier for you. Are you back? Can you see the screen?
Yeah, I'm back.
Yeah, so let me run the slides because it'll be easier. Go ahead.
Sure. Sorry about that.
No worries. Go ahead.
So, yeah, I think like Pooja was mentioning, we are a group of people under the age of 30 across the globe who work on addressing local, regional, and global challenges. And in numbers, we are around more than 9,600 people in all, based in 422 hubs in 151 countries. So as you can see, we have a global reach that helps us a lot when we're addressing a lot of challenges that have a lot of interconnections. And all these hubs, they function independently, and they're completely volunteer run. They have democratic processes on how we fix particular initiatives and make changes. And the Global Shapers community has done a lot of significant change over the last, let's say, a decade or two that they've been active. And the Global Shapers Bangalore Hub that I belong to has been present for more than 5 years now. And the mental health is a major focus area for the Global Shapers community. And especially at Global Shapers Bangalore Hub, which I'm a part of, we have a separate mental health vertical where Shapers dedicated to just working on mental health work. And I lead that vertical for the past 1 year now. So could you go to the next slide, Pooja?
Yeah.
So I'll just briefly mention about our work pre-COVID, right? And I think taking off from what Dr. Vikram said as well, India faces a huge mental health crisis in terms of the number of people we have, trained people we have in the mental health field. And we have less than one mental health professional for every 100,000 residents. And as Dr. Vikram had pointed out, among this infrastructure that exists and the people that exist as well, they're heavily concentrated in urban areas. And most of them are unaffordable to vast swaths of the Indian population. Combine this with the fact that there's a severe stigma existing around mental health, and this effectively means that large sections of the youth are completely blocked out from the mental health primary care system. So our aim is to change this in a significant manner in our hub in the beginning and provide templates that can help other hubs implement it in their respective areas as well. A key focus area of our work has primarily been to shatter the stigma surrounding mental health, to make sure that people are able to have conversations around it so that in a non-judgmental manner, and also develop non-specialist frugal interventions, because we realize that one of the key challenges that faces people, right? Like even if they know that they're having a mental health issue, for instance, they're not sure who they can reach out to, who will be able to provide them treatment in an affordable and understanding manner. And lastly, we believe that to achieve these two aims, right, like both shatter the stigma and to develop, like frugal interventions that focus on community-based interventions, we want to use technology as a significant enabler in our tasks, simply because of the fact that we believe tech has the ability to scale up rapidly, and especially over the last few years, where a lot more Indians have been able to access internet, the barriers to entry become much more lesser. And these have been some of our key focus areas. And I'll talk a bit about the specific initiatives that we do, about whom I'm sharing some of the pictures over here. Pooja, if you go to the next slide. Yeah. So just briefly mention to you about some of the initiatives that we're doing and also the impact that we've had, right? So the Global Shapers Mental Health Training Initiative was something that was a cross-hub initiative by 11 hubs across the globe. And it was built on this model called the Friendship Bench by Dr. Dixon in Zimbabwe. Zimbabwe faced much similar, in some cases, more severe challenges as compared to India. But one state, they had only 12 psychiatrists for a population of over 10 million people. And he came up with this community-based intervention where he trained people to be empathetic listeners and provide basic mental health care support to people in their communities. And a lot of these people would be elderly people in the community, and they were referred to as community grandmas. And he's developed an entire training module based upon which people can be trained to be empathetic listeners and provide some level of support. And this is what we have been, and our plan was to make sure that these hubs are located in different locations across the globe, adapt this material to the local nitty-gritty. For instance, in India, issues like caste is something that's like a very Indian concept, right? And how it affects people's mental health. So taking the concept of the Friendship Bench and adapting it to our local realities and training people who would be able to create a sort of sustainable curve where over time they would train other people in their communities and so on and so forth. So that was what we were working on. And we are looking at impacting youth in 400 plus cities who cannot afford therapy right now. And secondly, another initiative that you kind of, raise awareness about this in a fun manner was called Loan Pack Letters. And the idea behind Loan Pack Letters was very simple, right? Like use the nostalgia that we get in receiving letters to spread the idea about mental health in a fun and engaging manner. A lot of times when we talk about mental health, immediately people's minds tend to switch off, right? Like the taboo around it makes it difficult for them to engage with it in a meaningful manner. So we said, instead of let's make this interaction a bit more fun, right? So we said all of us have this joy in receiving a handwritten letter, and nowadays we don't get that joy much. So what we said was, wherever we were conducting events and like talking to people, etc., we asked them like, hey, can you just take a small sheet of paper and write down something that would put a smile on your face or somebody that you care about when they're going through a tough time? Then we collect these letters, put them in an envelope along with a note which said why mental health is important and how small steps like just like asking your loved ones how they are doing, etc., can make a huge difference in their people's mental emotional
How
well-being.
did you how did
And
you
we
come
play
up
it in
with the
public spaces.
sorry, how did you come up with the name Loan
Sorry?
Pack? It's a very interesting. How did you come up with the name Loan Pack?
Okay. So I think the name of the NGO as such, it was suggested by my female co-founder Samya, who started it initially,
All right.
and
All right.
she believed that a lot of people who are going through a mental health crisis, right? They believe
Yeah.
that they are alone, that they believe that nobody is facing these issues. But like Dr. Vikram said, especially in India, large swaths of the population are going through it. I want to
Sure.
get the notion that you might think that you're alone, but you have a pack of people who are supporting you, who are going through the same challenges, and we want to give them that feeling.
Sure. Awesome.
And we
Should I
started
move
out
on?
loan pack letters. Yeah, I'll just stay on the slide. I think we started loan pack letters in a small way, and with around 2,000 letters in our first edition in 2016. And based upon the enormous good feedback that we received, we conducted in 3 editions over the next 3 years, increasing the number of people we partnered with, increasing the number of what do you call places we visited, etc. And we were able to reach across to 80,000 people across 23 cities in India and a couple of cities abroad as well. And over 30 plus institutions, including some of them which you can see over here, including Uber Eats, Google, Zoho, Dunzo, they were very helpful in spreading the message out. So those were the initiatives that we were working on currently. And when the COVID crisis happened, and for those of you who are not in India, we've been under a complete lockdown since March 25, which is the most strictest form of lockdown implemented anywhere in the world. Restrictions on public gathering were there from much earlier. And all these led to the fact that we weren't able to organize workshops to train volunteers in empathetic listening. And this was very, what you call, unfortunate timing for us, because this was when we'd finally been able to create the module, kind of find it the Indian context, and we wanted to train people to quickly scale up the community healing process. But this was a huge spanner in our works. And similarly, on the loan pack letter side, it was not possible for us to collect or distribute letters. And all our ongoing awareness activities, where we used to go to schools, colleges, and conduct awareness talks on subjects like including mental health connected to different avenues, like for instance, gender and mental health, etc. We weren't able to do these.
Yeah.
And so it significantly put a huge blocker on a lot of initiatives that we were working on. And if you could go to the next slide, Pooja. So initially, I think for the first 1 week, a lot of us were stuck with our own problems with regards to lockdown, dealing with how are we going to deal with our personal problems, getting our life in order. But once it was sorted, I was really amazed by the amount of enthusiasm showed by everyone in my team as to how can we get things to normal. I mean, like, how can we get these things to serve people as soon as possible, right? And there was a very quick kind of like converging of minds around what can we do, how can we overcome these challenges. And we decided, all right, let's use, a lot of us were techies with a technical background, and we could, like, we had experience in coding and developing applications, and we were like, hey, like, we might not be mental health professionals, but we know coding, and we had material developed by reputed organizations like Mind Foundation and Friendship Bench. Can we just like go, like, do what we do best and do some online intervention for that? And so we sat together and we developed an online anonymous peer-to-peer support system, including modules for volunteer training, simulation of chat so that we could test them and rate them online, and finally a chat portal for where people could log in and have an anonymous conversation with an empathetic listener. And this was done in a very rapid manner, like everybody working remotely over a period of, let's say, 2 to 3 weeks. We launched the beta version last week, and we've already enabled more than 100 conversations on the platform, and it's more are counting. And another area that we tapped into was that we realized that, all right, we're not able to get a physical space, we're not able to assemble physical locations for us to have mental health. So what else can we do? We realized that a lot of people in our community were people having podcasts, people doing blogs, people using online channels in various different ways. So we thought, all right, can we use them to advance the cause of mental health? And one of the examples that I would cite is we've used this podcast called the Indian Millennials, which is run by a global shaper in the Bangalore Hub by name Rohit, which focuses on millennials doing inspiring work in different fields. And we used it to focus on people doing their own initiatives in the field of mental health. And we use it as a forum to to show the height on these people, the work they're doing, and also as a way to disperse information on how people can take care of their own mental health during this lockdown. Like Dr. Vikram was saying, also direct them to these government resources which are available, which unfortunately a lot of people aren't yet aware of. And finally, we also came up with, and another thing that I want to highlight is that we don't necessarily have to think, when it comes to using web tools, right, it doesn't always have to be something that involves coding or programming knowledge. It can be something as simple as a Google form, just creating it and putting it online. For instance, Loan Pack Letters, we kind of pivoted it to an online approach where I created a simple Google form, said that, hey, if you have something nice to tell someone, enter this Google form, and we will send you a nice quote on your behalf, and you pass it forward. And that became a kind of positive feedback loop where people were sharing messages and, like getting messages in return. And the kind of positivity and the kind of what do you call small rays of hope that it provided, and the feedback that we received from that was really inspiring as well. I think so. That's another thing that I want to emphasize, that when we say use of tech and use of online tools, it doesn't necessarily have to be something that is reinventing the wheel or something like that. A lot of the tools are already very simple to use, like Google Forms or the Zoom conversation that we're having right now. And all it takes is just like figuring out how best you can use it to your use case over there. And I think one of the things that we have learned from this is the importance of online tools, and also some of the challenges that are there in online tools as such, right? Even though a lot of people are able to use online tools, one of the things that we figured out was, language is a significant barrier. I think that's something that we didn't realize when we were developing tools. Since all of our online content was in English, people faced issues who were not very well versed with English as their first language. So that was a learning process for us. And in version 2, we are planning on how we can incorporate Indian languages in our online versions as well, the way we do our offline interventions. And I think the biggest learning that we have got from this is, irrespective of what challenges come across, as long as you're able to pivot quickly and you have a team that is consistent and committed to the cause, we can move fast and serve people the best we can. That comes to the conclusion from my thing.
Thank you so much, Siddharth. You definitely put a smile on my face, with all the energy and the enthusiastic effort you all are putting together. Thank you so much. I'm sure, if we're out of time, if there is one ask, if you have from the youth who are listening to you right now, and if you can say it in like 30 seconds, what would that be?
I just say take care of people around you, take care of their mental health, and ask them out. Just take care of the mental health of the people around you.
No, I specifically for your initiative, I meant. What is the ask? Is there something to reach out to you?
All right. So if you could just go to loanpack.org space app, which is our Loanpack Buddy, this thing. Try out the platform, and if you feel that any way that this can be improved, please let us know. Your feedback is essential for us to make a better service that can help everyone.
Fantastic. Thank you so much, Siddharth, for your time. I love the little chat we have. With this, we are now segueing to our next part of the present. Thank you, Siddharth. You can switch off your video. We are segueing to our next segment of the Boma India stream, and I would like to welcome Dr. Deep Bali on the stage, as we call it, or rather Master Shifu, as he's called in this part of the world. I'm going to give a little bit of introduction about Dr. Deep Bali, who is my partner also. He is the CEO of Boma India, founder and CEO of Recalibrate India. He is a Columbia University coach. And for better part of the last 2.5 decades, he has been coaching very successful leaders and CEOs spanning multiple geographies and across industries. Over the years, his areas of interest and expertise have been brain sciences and specifically whole brain thinking, which is what we'll be talking about today, applications of neuroscience, ontology, and in addition, for the last 15 years, he has been an ardent student of Eastern and Western philosophies and spiritual learnings. He has learned in the company of living masters like Swami Rama, the Himalayan master, and Dalai Lama as well. He frequently meditates in the secret caves of Guru Padmasambhava in the Himalayas. And the little known fact is I accompany there as well, along with him. For last few years, he's been working with large MNCs across France, America, and India to design what we call whole brain teams. And also, there are times when many CEOs call him just to have conversations around immediate issues, wherein they can leverage their whole brain, and that's extremely impactful for them. He is frequently invited by these schools for strategy talks and specifically around whole brain. He's been actually an international practitioner of whole brain and mentored and by creator of Neatling brain instrument of whole brain thinking, Dr. Cobus Neatling himself. So today, what we're talking about is the most relevant piece of machinery, or rather an instrument a human being has, which is our brain. He's going to be unpacking a lot of very important brains in the history of humankind right now, and leading us as individuals, as leaders, as homemakers, as parents, as to how we can leverage the power of whole brain thinking to respond to the calamity we are in. His talk is informed from the research he has done over years, his own experience, and the ground reality which we are part of right now. I'm going to just share my screen. Give me 1 second. All right. And we are on. So 1 second, please. All right. So, Deep, or rather, as I said, Master Shifu, whole brain, the term itself is very intriguing. Tell us more about it.
Sure. Thank you very much. And I'm absolutely delighted to be sharing some thoughts, some insights, and some tools, in fact, in today's a little discussion that I'm going to have here with Pooja. Hello, everybody. I'm sure we have a great audience from around the world. I know it's late for some, it's very early for some, mid-afternoon for some, but that's the whole piece and advantage of doing things online. End of the day, you get to reach them all. So thank you very much once again for inviting me over. And before we get to your question, Pooja, I think there are two things that are really happening today in the world, which is, one is an unprecedented event that has happened, and we know about it. We're talking about COVID-19, which is really spreading like fire. It has taken its toll, still taking its toll. There is hope, of course. There's always hope. Humans are very intelligent species. They will find a way. So that's the one thing that's happening. And the other thing that's happening is countries and people respond to this event. These are the really two things happening. One is the event and the response. Response of leaders, response of governments, response of citizens, people, what have you. So the point here is the two things that we're going to talk about is, today, how are leaders, kind of unpacking, we take a sample size of 4 or 5 leaders today of different countries. How are they really leveraging their brain? So we are going to talk about what whole brain is to start with. So the effect and the effect that it's having, and how thinking and brain preferences can really contribute to the response and to what we're doing, i.e. the decisions you're making. So the point is, it's a fascinating term, whole brain. Well, we all have a whole brain. And where I want to start with, and of course, my study and my practice is informed from Dr. Cobus Neatling's whole brain theory. So before we get there, just a bit of context. Whole brain really is about, elongated, a refined form of split brain theory, which is really originated around 1940. Sperry did a lot of work around it. And then over the past 30 years, Cobus Neatling, along with Paul Torrance and many other scientists of various universities and psychologists and psychiatrists, in consultation, they came up with many models, and finally, they came up with a set of instruments wherein they really divided the brain in 4 parts, right? So we'll come to that. So that's the essence of today's talk. For the audience and everyone else to understand that, hey, these are the 4 parts or quadrants of our brain with dimensions, and how each one of us through our lives actually gravitate towards 1 or 2 of those parts, which we call our preferred areas. Now, today what we're going to discuss how we can leverage the whole brain and also understanding with clues our preferred quadrants and then navigating through them in different settings, in different contexts, in the environment that we have today, which is a highly uncertain and complex environment. Yeah. So if we move on and try and first understand, okay, some metaphors here, brain is like a spider web. It's delicate, it's hypersensitive, and it kind of connects many things. Now, whether those connections are distorted or generalized, or there is a lot of information that's missing, is a different story. But the point is, brain makes these connections. And like a web, I don't know if you ever tried touching a web, it responds or reacts very fast. It kind of just simultaneously, it'll just respond. Either it'll just close up, right? Or like a prism, you take a prism, it sort of breaks light into many colors. So a brain will break a single information into many parts. And that's what we'll talk more about, right? So moving on from these metaphors, these are pretty commonly used metaphors. Yeah. So let's come to the whole brain now. When we talk of whole brain, I think in this first part, I only want to sort of highlight the parts of the whole brain. What do we mean by that? So there are 4 quadrants. So the 4 quadrants are, the 4 areas are an analyst and realist, which is, you could call it the left front part of the brain, and L2, for the sake of keeping left and right, we say, okay, is the left bottom part or the left behind, right? Top and bottom part of the brain. Then we have the right-hand side, which is the R1 and the R2. Now, you also would notice here that L1, really, when we say analysts and realists, so this is a quadrant. Now, this is a quadrant which if you prefer this quadrant, like I say, we all prefer 1 or 2 quadrants at best, but we kind of use all of them, right? So if you talk of realist and analyst, and say you are this person, so if you look at this little person here, you're this person, and you have a situation. Let's say you have a situation in front of you. You have an event, and for the sake of discussion today, let's say the event is COVID-19. So typically, what individuals have started to do, they gravitate towards their preferred quadrant. And we will come to how one knows these quadrants. They're instruments we work with, and these are assessments where you get to understand your quadrants. Now, typically, if you gravitate towards L1, what happens is as soon as you look at the situation, you get into deep diving, doing research. You like to get more information on it. You like to get accurate information. You like to stay focused on, hey, what is really happening here? What is the information I need? Yeah. So I'll leave it there. Now, if you were an L2, there are people, if they prefer an L2 part of the brain, L2 quadrant, when they look at the same situation, they will gravitate. First question that comes to the mind would be, how am I going to cope with this? It's like, how am I going to restructure or structure my life? These are people who like the L2 quadrant, who engage more of the L2 quadrant, who are comfortable with this quadrant. They like status quo. They're not people who like change without an order, right? They like the plan. They like all of this in place. They like to preserve the current situation. Now, this tells you about the L1s and the L2s. And for the audience, you could be any one of these two, or then let's come to the R2. Now, again, the same situation. If R2, that is a socializer, empathizer, you would gravitate towards straight away thinking of others, thinking of yourself. You will think of communicating with others. You will think of supporting others. You would wonder, hey, what will people go through? What will the poor go through? What will the migrants go through? What have you? But the point is, straight away your mind goes to others. You start looking at society per se. Now, if you were an R1, which is an imagineer and a strategist, you would be looking at possibilities. Okay, what are some possibilities here? What's the risk I can take? And try to be too intuitive. And also, you know, it's fair to say heroic. You know, you would want to be heroic. You'd be more courageous and all of that. Now, this is exactly and validated research, and this research is based on a lot of science. These are the 4 quadrants and the 8 dimensions that all of us have. That's how our brain is composed if you break it into parts. It's not just the left and the right. It is left bottom, left top, right bottom. It's the 4 quadrants. Now let's you know, in today's scenario now, let's see how some of the leaders who've responded, and so it's important to understand here. The key part is first knowing that, wow, okay, that's what I do normally. One of the 4 quadrants, or maybe 2 quadrants, you know, you able to relate with this. Then once you've understood it, we will go further as we go. We will learn how do you navigate through this, and it's a very simple process. That's what we mean by leveraging whole brain, not just your preferred style. Yeah, Pooja, you have a question.
So I think given that these are preferences and not really a type, which, you know, some of the corporate leaders and HR leaders have been used to, if you can shed some light on, you know, how do people pick up the clues as to what their preferences are? And so that then they'll learn to navigate. What is it which they should look for?
Oh, yeah, good question. Typically, let's take L1s. Now, L1s, because they love information, they like a very accurate, cut and dry kind of approach. Okay, forget the airy-fairy stuff. Give me the information, and they want to make sure the information is accurate. And because they engage that quadrant, they like to do a lot of research. They like the numbers. They like control. They like control.
These are the people
like to control.
Looking through all the newspapers right now and getting.
Oh, yes. Oh, absolutely. They are the ones who are obsessed with information. And so it's important to state here, Pooja, that there is nothing wrong or right, and there is no perfect brain. It's about understanding your whole brain and then going to a quadrant which is the most appropriate in a given setting, which is what is the next part of our conversation. That, okay, what are the appropriate quadrants to engage when you are playing with your child, or when your child is not performing, or your child is anxious, or the whole country is anxious. It's going through a pandemic of great magnitude, unprecedented, never happened before. Now that brings us to how you first look at your brain as an instrument and not just a resource, where, okay, you know, your brain is meant for thinking, for making decisions, for solving problems, for looking at various issues, all of that. No, brain is far more than what we believe it is. And this brain theory, which is based on science and very validated because you've used it a lot, is an amazing tool to start navigating through the quadrant. So let's take it, let's look at some real pieces from, are there some questions that you want to,
let's unpack some of the leaders,
yeah.
You know.
Let's do that. So
what whole brain is now.
Yeah, let's do that. See, when you look at the world today, let's take the German Chancellor, and I've got some quotes here. So if you look at these quotes, you get a sense of their brain quadrant. Which quadrant are they addressing the issue from? So if you look at this, this is serious. Take it seriously. Now, a matter of fact, L1. So she's looking at information. She's saying that, hey, this is serious stuff, right? There has been no challenge to our country in our acting together in solidarity. So she's giving a very L1 and R2. So she's here giving a lot of info, and accurate, realistic. So L1 is realistic. She's being realistic. At the same time, guys, we need to come together now in this, right? Now, if you look at the other quote of Merkel, for someone like me, now see how she's relating. She knows how important it is for people to move around. She knows, you know, humans are not a species that by nature are meant to be moored to the shore. Humans are by nature meant to be out there in the ocean. They're designed for the ocean. They're designed to be there, face the choppy waters. We're designed like that. Now, what she does is she goes back to her days in Eastern Germany, where she spent her youth. And that's where, at that time, she fought a lot about movement, because this was at that time when movement was restricted. And she felt even at that time, no, that's a basic need of a human. So she's comforting her people, saying, you know what? So she's taking a very L1 R2 approach here. Now, if you recall, L1 is being a realist and R2 connecting with the society. You know what? I feel like you feel. And freedom is important. While we go into a lockdown, no, it's a very hard decision. We don't want to do it, but yes. So let's take a contrast. Let's say, let's go to Donald Trump now. So now see, his brain preference is very R1. Now, R1 are people, when you talk Imagineers and strategists, they are people, they like to take risks. They don't like status quo. And a bit of L1 where I am right, I'm correct, I know it all. So because they believe they have a lot of knowledge, they have a lot of information, which may be true. I'm not, so that's what I said, there's no right or wrong. Now, Donald Trump's approach is very R1 and L1. So there is that, so last year, 37,000 Americans died from the common flu. It averages nothing is shut down, life and economy go on. Now that's a very R1 approach. That's an approach, that's a courageous approach. The point is, nothing about right and wrong. Now, when leaders and leaders I work with, when they learn their brain and they learn their preference, they beautifully change that to the context. So in the given context, I'm not sure if this could be the right approach. Not, we'll stay with Donald Trump. Yeah, just to unpack it a bit more. Now look at some of the comments. Ours is not a country built to be shut down, which means a bit of L2, like, you know what, guys, we are going to maintain status quo. We are going to do business as usual. Now, here I'm talking about initial responses of these leaders, not through, these were around February, you know, early March. These were some of the responses of these leaders. Very, very, you could see the contrast. Merkel, even at that time, was realistic and very empathetic. Donald Trump, no, courage, intuitive. Okay, you know, I know this is going to pass. We're going to fight it. We're not going to shut down, that kind of stuff, right? And then again, it's my decision when to reopen. Again, a very L1. L1s would talk like that. It's my, you know, I know best, right? Now, again, there's nothing wrong or right. The point is, all these leaders, they are operating from their preferred dominant brain. They are not navigating because many of them would not know it, right? So if you take the second one as well, so because we have done the risk of the American people remains very low, we have the greatest experts. See, that's a very L1. Again, we have the greatest experts. We know it all. And again, R1, right? So moving on to Jacinda Ardern. Again, if you bring up some of her, see, she had this beautiful conversation with the chief science advisor and Dr. Michelle Dixon, again, of the medical institutes. A very informal chat on video, beamed to the nation, just kind of chatting with them so that there's transparency, and she's asking questions that everybody needs to know about. They want to know, hey, what really is the issue? How difficult is it going to be? Is it really that scary? So normally, see what prime ministers or presidents would do or advise, they would come and say, hey, we've had a talk, we've had a chat, and my chief medical person, XYZ from the health department says this. What she did was, she actually had that chat live so people know that, yes, there is no color. Now that's a very R2 approach, which is empathizing, in touch with the society, in touch with people. But look at this. Look at the last one. Make no mistake, this will get worse before it gets better. If you see that. Now she's taken an L1 and R2 approach. Now Donald Trump was taking an L1 R1 approach. She's taking an L1 R2, knows that information is critical. I need to be accurate and realistic. L1s are realistic people. You know, it is what it is. At the same time, she's coming to that quadrant, walking over to the other part of her brain and saying, hey guys, it's still okay. We are doing a lot. Her piece is, we want to stop this. We want to eradicate it. So they're going with a different mindset. And that's a bit of R1 there. So R1, what I'm saying is R1 is equally important, but supported by other quadrants. Now, if you look at some of them, they are again using two. Have you noticed they're all using two dominant quadrants here, right? So moving on. Now, if you look at Modi, now what is he doing? It's amazing that most of the comments are very R2, very empathetic about the society, helping the poor in a state of lockdown, all of that. But again, it's not about right or wrong. Is that good enough? People want to know, hey, what are you doing for the future? What are some vaccines? Are there some cure? How are the scientists? So that's an approach he's not taking. He's taking kind of, okay, follow the process and help the poor. And that works for a society like ours. But then what I'm talking about is agnostic. There is one real proper way, and which we're coming to. So I'll stop here. How does this look like in terms of how leaders also are gravitating and responding from their preferred quadrant? Now I will come. The next point is, then what's the most appropriate brain profile? So if you bring up the profile, let's say, of these leaders, so we've talked of the analysts, these leaders, we've talked of the L1s, which is, you know, people like Donald Trump, and there are others, you know, the Prime Minister of Brazil as well, and even Boris of UK. They're mainly L1, R1. So you notice the similarity. Some information, we are right, we know it, and you know what? We're going to defy. So R1 are unconventional. They like an unconventional approach mostly, right? Now, the point is as you go further on this slide, so this then would be, yes, this would be the ideal whole brain profile in terms of crisis. Leaders will want to be high on L2, which means a process, structure, discipline is key, and safety. So the key word here is safety. And L2 is a zone which is about safety, because you follow process, you are structured, you have certain status quo in place. And then the R2 is important, making sure people understand they are connected to what's really happening, what's the strategy. R1 is important, which you would notice is here more than L1. So I would recommend, my recommendation, and I would invite leaders to actually be more in the L2, R2 zone in this crisis, and R1, support it with your R1, with the future strategy, possibilities, because R1 is about possibilities, opportunities. And once you know this, the whole decision-making, the communication changes. So each quadrant, when you're in a different quadrant of your brain, you communicate from that quadrant. So for example, here, L2 is more about the how, you know, telling people how to be, how to go on with their lives, how to go to work, how to stay. That's the how stuff. Yes, Pooja.
So, you know, a little bit around, you know, the leaders or the CEOs or the entrepreneurs who are watching this right now. And you've shared an ideal brain profile there as well. Now, how do they resist the trap of not going to their ideal brain preference? And if I just clarify a little bit, let's say there is a CEO or a leader who thrives on looking at the bigger picture and then looking for information for it, and that's an ideal CEO profile, and you've worked with many. So how do they just unshackle from that and then move towards this ideal profile which you're referring right now, especially given the crisis we're in, because people would be thinking from all the quadrants right now and they're scared.
Sure. That's a good question, because the point is, we always, because that's a preferred zone, whatever, we will first gravitate, I said. We will tend to respond from that zone. Now, your question is, how do they? It's done consciously. That's the simplicity of knowing your brain. So first is awareness, Pooja. When a person is aware of the 4 quadrants, I say this with a lot of confidence because I worked with tens and tens of leaders now, all across, spanning geographies. Just the awareness that, wow, these are the quadrants and these are my preferred, and yes, this is where I tend to go and spend more time. So it's about spending time. How much time are you spending in these quadrants? So if you prefer L1, common sense, you will, that's where you draw your energy. So you draw your energy from there. Now, how they do it is very consciously. It's very simple. Once you understand the context, then you know that, okay, if there is a crisis situation, I normally am an L1 leader. I am a realist, mate. It is what it is. This is what it's going to be. I'm going to shaft XYZ people. There is going to be, people who would, be terminated, all of that. Or we're not going to spend, there's going to be cut in your salaries, all of that. That's a very traditional response. Now, if you're using, my point here is, how effective are you as a human being if you're only using 1 quadrant or 2 quadrants? So for this leader, through awareness, and that's where the coaching piece happens, because mostly it happens through coaching. In such a scenario, they will actually move from the traditional and try the R2 communication, because people are now scared. They have anxiety, they have fears, they have concerns, and they have hopes. So, how do you move around the brain? And that's an art which is so simple and so easy to learn once you only get a sense of, okay, these are the quadrants and this is what one does in these quadrants. Yeah. So they have components. Does that answer your question?
Yeah, it does. Should I move on?
Yeah. Moving on. Now, today, let's talk of today. There is this calamity. We talked about mental health. Dr. Vikram came and, he shared a lot through his experience and knowledge about how would you respond and what could go wrong, what could happen. What I'm sharing is something different, i.e., how can you prevent from even getting there, even getting mentally ill or feeling anxious or phobias, concerns, what have you. And due to that, you could end up into depression or, things could go wrong, right? It might impact your physical and your behavior as well, which we have started to see. Now, navigating the whole brain is about, for citizens, for people like you and I, for all of us around who have jobs, who have families to take care of, who have businesses to take care of, and the first responders, as you would say, the people in the health industry, doctors, all of this, the whole ecosystem. In today's situation, the ideal way is no ideal way. You navigate the whole brain. So what does that mean? That means that ask yourselves, go to the L1. So if you see that L1 triangle, it's kind of shortened. It's not expanded, which means spend less time engaging in L1 for people who are obsessed with information, who are forever looking at what's next. you know, what's happening in Iran, what's happening in Italy, what's happening in France. And my God, okay, so what we do, how do we navigate? It's simple. Just go to the L1, use it minimally. For some time, that's a great quadrant. If you're working in a scenario where you need a lot of data, your decisions are based on research, all of that, great. But in today's day, it's got to be minimal. No, so what I'm saying is know about the specific progress being made only. So ask yourselves a question, what do I really need to know? Do I really need to know how many deaths or how many infections are happening across the world or even in my country? Do I really need to know that? How will that information help me? It's not going to, which means become less of an analyst and a little more of a realist. And also, what's the status in your area? Maybe your specific area is good enough. And some key emergency contacts. Who do I contact? And all of that. That's what you would do to start with. Then you go to L2. L2 is where you would spend more time. In today's, and that's, for me, that's a quadrant I detest. That's an average for me. For me, that's an average preferred quadrant because I know my brain preference. Yet in today's time, that is probably the most important quadrant to make sure you're disciplined, following guidelines, and organizing yourselves. Know in advance, okay, I will go to the supermarket once a week at best. So making your list, sticking with the list, discipline, spending. So that means spending more time planning and organizing. That's what I would do, right? Now, let's go to R2. This is again an important quadrant in today's day and age. You want to stay with friends, families, kind of connect with them on WhatsApp, because that again is a quadrant of positivity. You're getting positive vibes. You're supportive. People are supporting you. Now, what that says is, while L2, you might say, is a quadrant of, it's coming from a bit of fear. So, okay, so let's follow guidelines. This one is really, who else can be involved? Who else can we include in our environment? And you have a lot of applications. People are having these online parties and that kind of stuff. The other day, I got to know people are playing online chess and all of that. So people are, and that's a quadrant. What I'm saying is, that's what you would spend more time on. Now, the question here is, the L1s don't like R2 as a quadrant. Those who prefer L1, they don't like to engage with people too much. They are people who are accustomed to focus, being on their own. Now, that's the beauty. Now, when they understand this, then they know consciously, hey, I'm going to use my brain as an instrument, not just my traditional way of thinking. I'm going to go spend a lot of time on R2 and L2. I'm going to go in these quadrants. Let's go to R1 now. That's another important quadrant. So I would spend time on R1. It's a little expanded if you see, but it's still lesser than L2 and R2. Means this is a great time. Spend at least some hours of the day in the opportunities, in innovation. How do you be more creative? More creative, though you can be creative in every quadrant, but in terms of, what are some possibilities now? What are the opportunities? So summing it up, this is how an ideal brain would look like in terms of preferences in today's environment.
That was really fascinating. And given the fact that, I myself practice whole brain, one question which actually came to my mind, I'm going to stop sharing the slides and bring them back. So, while you're mentioning that we are going to, this is more to prevent the mental issues one can go through. But the question which comes is that, I'm used to thinking in a certain way. I will get drawn there.
Yeah.
So how do I catch myself now that I have a little tool with me and you've given me, small, if I'm overanalyzing, just catch myself do it. If I'm over empathizing, I can catch myself because I can get drowned in the misery of others because there are some, catastrophe catastrophic talking people can do as well. So, now that I have a tool, I will use that tool. What are some other suggestions or best practices you have for, every day, or a parent or a citizen, or even for that matter, first responders or the healthcare workers, so that they can leverage this tool to avoid themselves from getting into that mental health tangle?
So it's very simple, Pooja. I already shared that this is how, in today's environment, you would engage with your brain, i.e., very less in L1. So the point is, the first thing an individual would do is draw a circle, draw the 4 quadrants, and then draw a shape of what shape would their brain look like, exactly as the shape that I just shared, which means they already know, you know what? So first they need to be L2. They need to be planners, organizers. Get organized, guys. Draw the shape of your brain, and then stay disciplined, stick with it. So I would put, okay, I'm going to spend 10 minutes only every day on L1. Pooja, I have started to do that a long time ago, and that is the whole piece here. Be disciplined. So 10 minutes on L1, I don't need that kind of information on COVID. If I am researching, it's more to do with subjects that interest me, things that I am gaining knowledge on. I don't need so much information now on. So L1, very, very filtered L1, shortened L1. I'm not going to spend time there. I love that, but no, you know what? I'm going to put everything else off. I'm only going to read the positive stuff, my subjects of interest, or things like maybe if there is some, figures or stock markets, what have you, and things like, what's happening in the animal kingdom, what's happening with science, what's happening with technology. And I like these subjects in philosophy. So I would do that, of course, but I would totally stay away from the COVID information because I have all the information I need. Then these people would just spend time organizing themselves. Like I said, easy. It's very easy. Make your list, spend time there, be disciplined. What do you need in the week? Go once a week or once in, or 2 weeks, that kind of stuff. And so they would say, I'm going to spend X amount of time in the how part, the how part. Trust me, what that means is obviously people are spending time in execution. They are planning. So they can't spend all day there. But the point is, when they consciously know this part is important, R1, like I said, R1 is expanded. Okay, now what can I do? What are the opportunities? I would spend time in R1. I would spend time possibilities. What are the opportunities? Yeah, what can I change? Because R1 is about change. So you are a strategist and an Imagineer, imagining. I would spend a fair amount of time there, right? And then R2, of course. So the point is, the moment one starts to do this, the results and the outcome is very, very clear. Yeah.
Yeah. So how we listen or consume the information which is being bombarded at us from the media, from the newspapers, from prime ministers and presidents who are coming on TV every day. So how do we now, are you saying that now that we have the tool again, there is something which we change in the way we are consuming information as well? Because that's where it stops. You're saying filter it out. Is that how I should interpret this?
Yes, so I think most of us are talking about filtering it out. I'm talking about actually not getting into that, engaging the L1 too much. Or if you are, be more realistic that this is what it is. I have this information. Question is, what is the information I need? What is the information I want?
Yeah,
what is the information I must have? Ask these 3 questions. So what do I really need? What do I want? So obviously different people will ask different questions. So if I were a health worker, I'm a doctor, I'm treating these patients, I would of course get deeper into it, into the cause, but that's because of my profession, vocation, what have you, my practice. So I have to get deeper into it. The point is, if you're not a doctor or a health worker, you have no need. Or if you're a scientist doing research, you will obviously need a lot of figures, a lot of numbers, right? But for Common other people and citizens who are doing other pieces, they cannot handle that. They don't know how to respond to that information. And it's no good for them. It's absolutely no good. And I think the point is, we all know what troubles us. You know, one is about filtering. Intellectually, we all can work with certain information. People don't realize that before you start working with any situation intellectually, and that's brain science for you, it already has triggered an emotion. It already has. You may work with it, but the point is you've already manifested, and that shows up in the now. People are tentative. They're not very high on energy. You know, very few are. And yes, of course, there's a point here. People who are really busy in this environment are the people who are handling it the best, because they're just so busy in what they're doing. They don't even have a chance to really ponder, mull, what have you. So that's an advantage. People are busy doing stuff. They're going on. You know, people like us. I mean, look at Boma Global. What are they doing? I mean, amazing. They're creating these kind of summits, so they're keeping people busy. So that's a big one.
I guess it also depends on what are the stories we are telling ourselves. You know, stories of the future or stories of the past, and what are those stories? How does that play in here?
So stories happen in R1. Now that's the zone. The moment you get into that zone of, okay, you know, that's the theta state, a theta state, whether you're in your shower or whether you're reading a book or you're just meditating or you're out on a walk. These are R1 moments. These are beautiful R. So we call them moments. So what I'm saying is, guys, you should have these moments. I'm going to have an L2 moment for the next 1 hour as a family, guys. Let's organize as a family. What are we going to do in this week? How are we going to organize ourselves? So an L2 moment. Okay, I choose to have an R1 moment. Means I'm going to think, I'm going to imagine possibilities, opportunities, all of that. And I'm going to have an L1 moment. So you know what I mean? That's the beauty of whole brain theory. You decide which quadrant you want to be in. It is powerful, simple, and absolutely significantly remarkable in terms of results.
We just have 1 more minute left, but I want to ask one final question. I'm pretty sure that a lot of our viewers would be having this question. Our children, given that we know that this kind of an instrument actually applies to children as well. So what is the advice you have, for the parents to what to watch out for when they are interacting with their children, so that they can pick some clues and then counsel them or work with them accordingly?
Again, I'll go back to drawing a plan that, guys, this is what our family brain profile will look like, and yours. So L1, we will spend X amount of time in this zone. So break it up into 4 zones and we'll spend X. Now think about it. Think about it. When you have such crystal clear clarity, the next part is being disciplined. And you know what? People who by nature are L2, organizers, preservers, they will love to do this because they are disciplined. They follow a structure. R1s will find this really challenging. The point is, the moment they start doing it, it's just amazing because they get results instantly. Unlike most tools and psychometrics or what have you over there, results take time. In this, it's so fast.
Yeah. So what, in essence, if we sum it up, we're saying that it's a tool to prevent before you get into a mental health, the maze, if I may call it, in itself as well. And it's a simple tool which our users can use based on the clues which Deep has already shared. I want to just check if there are any questions. I don't see any. There was one which I already asked. So thank you so much, for this insightful conversation, Dr. Deep. And now with this, we're going to be moving on to our next.
Thank you very much.
Thank you so much.
It was a delight being here. And yes, have the good rest of the session and all the best.
Thank you. Thank you so much. So now we're moving on to another insightful conversation, again, very different from what we have heard so far. We started with Vikram talking about where India is in terms of managing the COVID crisis we are in and where it has to be. Then we went on to Siddharth, who shared what youth is really doing in terms of this crisis and specifically in mental health perspective. And then Dr. Deep shared, a brilliant tool which we as average human beings can use on day-to-day basis to even avoid the mental health maze which we can get stuck into. And now we're moving on to Raghava, if I can just get him on the screen, Raghava KK, who will be talking about the role of creativity in crisis. Raghava, are you on? I don't see you. I do see you there. Can you unmute yourself and put your video on as well, Raghava? And there you are. So the phone is tilted. You'll have to turn it around.
Oh,
you're tilted.
Okay. Like
And
this?
We're good. We're good. We're good. So let me just introduce Raghava. Raghava is a multidisciplinary artist and a storyteller, and he's a co-founder at 64 In his own words, he explores the transcendence of art through the ambits of the current digital era without sacrificing the particular. So Raghava, you'll have to explain that for us because it was tough for me. So I just quoted you there.
Thank you for that.
Raghava was inducted into the National Geographic Society in 2013 as an explorer for pushing the boundaries of scientific exploration through art. He has had the honor of giving multiple TED Talks and is renowned for inspiring audiences to expand their social and psychological selves using art. So today his talk is going to be specifically for those solopreneurs who are asking some existential questions right now for themselves, specifically for them. And he would be talking about the role of art facing the future, the role of creativity in constructing new imaginations for the self and humanity, and just the overall role of creativity in dealing with anxiety and crisis these solopreneurs are in, specifically for them. So over to you, Raghava.
Thank you so much. I'm sure most of you didn't understand much of that. And so I'm here to explain. I'm an artist, and I want to talk to you about the role of creativity in art in dealing with a crisis. I want to start with my relationship with the crisis. And it turns out over the last 2 years, I've been having these meteors come and hit me. And just like the one we're all experiencing. The first happened when my wife told me all of a sudden, after 17 years of living together and building a family of 4 kids. I'm a very prolific artist, so I have 4 beautiful children. And she said, I don't know if this relationship makes sense to me anymore. I don't know who I am outside of this. And it threw me in the midst of a massive crisis, a crisis that shattered my sense of self, my sense of identity. And the second crisis was to move from America, which was 15 years I lived in America and built out this artist village. And it was my dream project. And finally, after building it and moving in, I had to move to India. And the third, of course, is this COVID crisis, where all my commissions, all my art projects have been, if not canceled, put on hold. And it's forcing me and other artists to ask ourselves, how are we relevant? Are we part of this luxury consumer market, or are we relevant in the world anymore? Are we fakes? Are we even, do we really believe in what we're doing? Is it relevant? And it threw me again into an existential crisis. And so I want to share with you how I'm dealing with it. So crisis seems to be a regular staple diet for me at the dinner table. When I was 7 years old, very casually, my dad asked me, Raghava, who are you? I said, Pa, I'm Raghava. He said, but I named you. If I change your name, will you change in front of me? I said, no. Who are you? I said, I'm this person. He said, every cell in that person changes every 7 years. Who are you? Oh my God, this is crisis. I said, I am my thoughts. And then he said, but if you're your thoughts, who's the one having those thoughts? I said, I'm my feelings. It's all about feelings. That's what it is. He said, if they're your feelings, who's experiencing the feelings? So existential crisis went on until the end of the dinner, we came to one conclusion. We all decided we are storytellers. And we asked ourselves, he asked me a question that changed my life. He said, if you're a storyteller, can you live the best story you can tell? And since then, that has been the motto of my life. I've been trying to live the best story I can tell. But there's one problem with living the best story you can tell. You may construct it, dream it up, execute it with integrity and full energy and force, but some meteor is going to hit it and it will fall apart. And so every time that has happened, it's forced me to go back to the drawing board. There's a beautiful saying, I don't know who said it, that when machines are attacked, they break down. But when humans are attacked, they reinvent themselves. And for me, that has been really at the core of my role as an artist. For me, art is not just about creating materials or objects of art. It's creating transcendent experience. Now, the word transcendent sounds like a very complex word, but let me sum it down to change, growth. It turns out that I feel dead when I don't grow, when I stagnate. And growth happens either when you choose to go out of your comfort zone and build a new sense of self, or when the world imposes that growth on you all of a sudden and you have no choice but to figure out who you can be. And of course, the second one is more daunting, but many of us wait for that moment before we can reinvent ourselves. We'd rather have painful status quo than actually reinvent ourselves. And so I want to talk about the experience, the feelings one goes through when you reinvent yourself. It turns out my brother, Dr. Karthik Kalyanraman, and I run 64/1, which is a idea. Quite honestly, it is just the two of us loving to talk to each other and coming up with ideas and interventions in the world. And one of the things we asked ourselves, we did research on what forces us to grow. And when we grow, what are the feelings? It turns out there are three predominant feelings. The first is loss. We experience loss. When we grow, a part of us dies. When I went through divorce, I didn't even think I could live without Netra. I didn't even think, in fact, I could take all the risk in the world knowing I have one person who believes in me. And now that was broken. And so there's loss. There's a part of me died. I'm never going to be that exact same person. The second is liberation. When there is nothing to peg your identity to, you have to ask yourself, what validates me? What makes me feel alive? What makes me feel valid? And then you'll realize the possibilities are infinite. And so liberation is the second experience you feel during change. The third experience is mystery. You don't know what the hell is going to happen. And sometimes you don't even know what's going to happen in 3 days, leave alone 3 years or a lifetime. So these three experiences are critical for any form of growth. And I want all of you to know that it's only natural to experience all those three. Now, what do you want to do about it? And it turns out that since we have the opportunity to go back to the drawing board, we have to practice detachment first. We have to let go. And only when you let go, can you actually free up your mind space to move on. Minimalism, materialism, consumerism are things we're familiar with letting go of. We've talked about, do you really need this extra gadget in the house? But one of the things we never talk about is, can you let go of your thoughts? Can you let go of your beliefs? And when you let go of your beliefs, do you fall into nihilism and meaninglessness? Or do you fall into an abscess where you start asking yourself, what is really me? What values do I really care about? Now, it turns out in a crisis, when you feel anxiety, my brother and I were talking about this in our show, Nothing Special. We just rant with each other on our bed and we create a show out of it. And what we talked about was that when you feel anxiety, you have the three kinds of anxieties that come into play. The first is performance anxiety. And when I say performance anxiety, I'm not only talking about performance anxiety in bed, but performing your identity in the gaze of another. To present your truest self to the world brings up anxiety. What if they judge me? What if I'm not good enough, smart enough? And that's one form of anxiety. The second form of anxiety is control anxiety. I want to build this beautiful construction of myself, but I'm not able to control the elements. Things are just falling apart. I'm not able to control the way my ex-wife thinks of me, my children think of me, my best friends think of me. And that need for control is a second form of anxiety. And the third form of anxiety is an existential anxiety. Who am I when I am not defined by the things I'm defined by? And that's where I think art plays a very powerful role. I think at the individual level, at the relationship level, at the office and corporate and friends level, and at a global level, we need to ask ourselves again, who are we? And what is the role we play? And it turns out, ironically, that there is no true self. You are constantly evolving and changing. So there is no one definition of self. And the only thing you could do at this point is to ask yourself, who do I want to be in my next step? And the way you do that is really by disassociating yourself with all the things you were and asking yourself, turn barriers into questions. And my friend Akshay does this beautifully as part of Limitless. We ask people, what are the key barriers that are stopping you from achieving what you want to be? List those barriers. Very often, they sound like dead ends. They sound like you've hit a wall. A barrier is a wall you've hit. But if you just turn that barrier into a question, it opens up infinite possibilities. For example, Akshay gave this beautiful example. He said, imagine you want to go on a holiday with your best friend to Goa, and COVID happens, and all of a sudden you can't go on this holiday. I'm giving you a trivial example, but hopefully it'll illustrate the point. You can ask yourself, oh my God, I can't go to Goa. There are no flights. Everything is getting shut down. This is before the lockdown. And then you say, I can't go to Goa. But if you turn that barrier into a question and you ask yourself, how else may I go to Goa? How else can I spend meaningful time with my friend? How else can I go to the beach? Maybe you can go to Pondicherry. Maybe you can go to, you have to go to the core of the intention and ask yourself, how else can I achieve that? And that's a great way to reinvent yourself. Now, talking a little philosophically, I want you to understand that for us, everything we do is a construction. Everything is a construction. And the beauty of life is to accept that it's a construction, make that construction with integrity, accept the meteors that may hit it, because you're going to deconstruct and reconstruct again and again. And the beauty is to have integrity, knowing at the same time that it's only a construction and it may fail. And when you're prepared, when I fell in love, I remember Nathan and I first, when we met, when we were teenagers, we said to each other, let us not live even one day together if we truly don't want to. And that was the way we prepared ourselves for the worst. Now, despite all of that beautiful talk, I was devastated. I want to talk about how you guys at this point can ask yourselves important questions. Not, I don't have a job. How else can I use my skills? How else can I earn money? How else can I blah, blah, blah? You can go through this barriers to question exercise, and hopefully you will use your creativity. You will use your imagination to achieve and see the different possibilities. Now, it's all good for us to talk about these things, but it turns out that deconstruction and reconstruction is a very painful process. Changing your behavior, your identity is really, really difficult. Much of the Western world is in the pursuit of happiness. In fact, in America, the pursuit of happiness, in my opinion, is the key cause for anxiety in the world. And my brother beautifully put it. He said, you know, the key cause for anxiety is free will. How ironic that free will is the cause of anxiety. If you don't believe you have free will, you have no anxiety. You just follow the tide. It's only when you have to think of your own construct that you actually experience anxiety. So I want to give you some very quick tips on how I'm dealing with this moment. Quite honestly, I have no answers. I spend 10 to 11 hours a day imagining who I can be, talking to my friends. at Limitless, we call this the 911 friends. Who are the friends you can call and talk about your deepest vulnerability? And when you talk about your vulnerability, I hope you don't do it from a sense of self-pity or defensive attitude. Take an offensive attitude, because you're alive, you matter. If you believe you matter, then ask your friend, how else can I shine? How else can I be who I want to be? And I think this is a beautiful moment for artists to come together. There is no market right now. There is no art world. This is the time we need to ask ourselves, how can we as humanity reinvent ourselves? And much of the activities I'm doing these days is talking to people in Colombia, Mexico, in the global South, in all over the world, really asking them, how are you inventing yourself, reinventing yourself? And so I think art plays a very important role now. I'm really excited to see artists in the avant-garde of the world. And you know, true power is when you realize that you give yourself permission to call yourself an artist. You are an artist only because when you think you have the ability to reinvent yourself, to change the world, to change a fundamental truth that we thought was true. So I will leave you at that, and I'll let you ask me some questions. Over to you, Pooja.
So Raghav, thank you for the chat you were having with the fellow artist. I am not one, but yeah, I do a little bit of doodles and to engage my creative R1 mind. If you were listening to Dr. Deep's talk, I'm a very high R1. So I doodle, I express my artistry through making some exotic food dishes as well. And my daughter's paintings are in the background as you can see them.
I see.
So the question which I have for you is, then I believe every one of us is an artist. Is that a thought we can go with in the time of crisis we are in right now? And can that help us somehow to deal with the mental stress we all go through? What's your perspective on that?
I was just going to correct you when you said I'm not an artist. I think you're very much an artist.
I am.
Right. But not necessarily in the sense that the market defines art.
Yeah.
And I think it's really important to ask yourself, am I giving myself permission to create a new version of myself? And am I willing to go through loss, liberation, and mystery? Because that's the hero's journey. That's the journey of the artist.
Yeah. All right. All right. So I'm not sure if there are any questions from the audience per se, but I have a question. So in terms of, again, I'm taking you back to the current times. You gave some tips about that, asking some, questions about how else, asking your questions about who am I? Another question, and I'm a coach, and a question which we really encourage our leaders and individuals and millennials we work with to ask is, who am I becoming? Rather than just the who am I. So in terms of that question, who am I becoming as an artist? Who am I becoming in this, maze we are in right now? What comes to you?
I think there are two forces that define who you become. One is internal and the other is external. The question you have to have before you go out to the world is, who do I want to become? And it turns out that when you go with that intention to the world, you will start attracting the things that manifest that. Now, whether you call that the universe conspiring to help you, or whether you call that you actively creating the life you want, I think more than asking who am I becoming, because that's something you can't answer, because you can never peg down an individual. What you can answer is, who do I want to become, and how am I engaging with the world to become that? And that requires deep confidence in yourself. And if your confidence is shattered, that's the best time to actually say, I have nothing to lose. Let me now follow my, my truest beliefs and feelings.
Sure. So I think when I say who am I becoming, I think, again, taking this back to more about acknowledging the present, which is that I am becoming more and more courageous. And if I again take you back to the whole brain of the talk Vikram had, reframing, I am becoming somebody who listens to everything, but filters out, what I want to intellectually first, and then it becomes, that's what I meant by who am I becoming. from that.
Fantastic.
Uh,
Right.
another thought, when the survival is questionable right now, right? Every morning, and I'm sure all of us have those thoughts when we get up, that we have it off and on, where we have our own methods of dealing with them. What role does art play in keeping us sane? And as an artist, what do you want to say to people who are listening to you, especially those young guys? And what can they do with art in keeping their sanity in check?
When we talk about survival, we have different aspects. There's financial survival, which is at the core of a lot of people's minds right now. Let's not talk, we have to talk economy if you want to talk art. There's a joke that economists, when they have lunch, dinner, they talk art, and when artists meet for dinner, they talk money. So let's talk about money. And when we talk about money, the question we need to ask ourselves is, money is a form of exchange for value. And if you look at money from that point of view, you need to ask yourself, what value can I generate given my constraints? So as an artist, for example, I'm involved with governments, with economies. In fact, I'm bringing out products every day. Now, these are not in the art world, but they're in the real world. And so, and the beautiful thing about this moment, as I've been doing this all my life, Pooja, but only now do I have the permission for people to say, oh, it's okay for this artist to actually be in the real world. And I think that's a beautiful moment. Let's use this opportunity to break the rules that we were adhering to within our silos. And so I urge everybody to really ask themselves, how do I want to survive? And you'll find out that that barrier can turn into questions, can be infinite possibilities.
Yeah, so you're effectively saying that, we go past the validation in a time like this and really just feel confident about what we want to create and what we want to do, and not worry about what's right or not. Because essentially an artist is in an imaginary world. The only thing is that imagination has to be a little bit more constrained so that it doesn't go into analysis paralysis, because imagination can run wild as well, wherein they can imagine a world which is going to go down the drain.
Yeah, that's why I always say artists have to do a tech startup or something in the business world, because fundamental difference between the two is an artist thinks, let me share with the world what the world needs.
Yeah.
And a technologist says, let me give the world what they need so I can monetize that, right? So the beauty is really about the balance between these two energies, about, hey, I want to give the world this, but do they feel the need for it, to experiment? So I've learned a lot from design thinking, from running startups, from having, I've done a lot of projects in the world, from being involved in producing a music album with hundreds of musicians. So as an artist, I'm learning from the business world. And as a business person, I think it's time to learn from the art world. And I think let's break these silos.
I have a question from the audience, which is, is the pandemic influencing your work currently, and how? I think you kind of shared part of it, but yeah, go ahead and answer.
So I can give you it's influencing me in every way possible. Let me give you one or two conversations I'm having. I'm speaking to a beautiful collective of people from the global south, and they're talking about, if you notice, a pandemic was used by the Western world to dominate the indigenous populations. I'm talking about smallpox in the United States. And they're asking, is this pandemic an opportunity for the global south to reclaim that narrative, right? And we're talking about reclaiming power. And then we all of us sat down and said, hey, do we want to use this very masculine energy, conversation and words, or do we want to change that around and say, let's reclaim agency, not power? Because we can't control. We don't want to be the enemy when we are trying to reconstruct. So I think it's an opportunity. Economies are going to shift to the East. And art has always followed economies. And I think it's a fascinating time for artists to ask us, where are the new areas of power moving, economy moving? And if you look at much of the art world is influenced by people like Kant and Hegel. And these are philosophers who created beautiful constructs of the self. Like we saw another idea of the model of the brain. But I do want to caution that these are only constructs. It's not reality. They help us transcend our current situation. And for me, it's like a tool. Whether you use you have different tools. use the tool where it's appropriate. And remember that no tool, no concept is perfect. Nothing is absolute, but use it to your advantage. And so we're using this pandemic in every way to grow emotionally. In fact, my ex-wife and I were on a Zoom call with the kids, and we were playing our favorite songs. I was playing on the piano, we were singing. It's brought us closer together. And I hope that this will bring a lot of people closer together, using love and not control, loss. Yeah.
Sure. Thank you so much, Raghava,
Thank
for
you.
your very different lens from the artist world. Thank you so much. With this, we will be, thank you so much. You can switch off your video. We would be closing the India stream and handing over to Kenya, who's, before Kenya comes on board, though, there is another half an hour session from Anahita. But before I get there, there is a question which was more generic, which was being asked, which I can answer probably. The question was that where are you guys in India and what the lockdown looks like there? Sure, a little underrated, but I can definitely help answer as to what's really going on in India. We are in Gurgaon, Kate's Haber, and Gurgaon, which is NCR Delhi, and we are in a similar kind of a lockdown, which, like, everybody else in the world is right now. Our lockdown started on March 21st, and in fact, it got extended yesterday till May 3rd. For a country like ours, which is 13 billion, we in fact was looking at a very interesting graphic which showed that most of the states in India, some of them are equivalent to UK or Brazil or Portugal. So the scale at which how India is managing the lockdown is pretty phenomenal. So it's like we are one country with at least 12 countries within it. That's the scale we are talking about. So, and ministers and the government is doing their best. The lockdowns are being followed extremely well. And that's what you see in the numbers, that numbers have not gone up drastically, even though now the testing have really gone up. That's what I can say from India's lens. All right, so from here on, I'm not sure if Anahita is on. We'll be wrapping up the India stream. And before I wrap up, I want to just, summarize, how we started from Vikram's talk, which was more from the lens of where India is right now, where is the mental health, and how it's impacting the billion population which we have in the country, and how he gave some useful tips about reframes and how to look at, what is the positive news which is coming together, and just look at the lens from, more positive rather than just looking at the numbers as to how people are dying. Then we moved on to Siddhartha, who gave a little bit of perspective about what is youth really doing in India. And then finally, Deep shared about a tool, which is a whole brain tool, which can be, you can call a preventive tool to even, for you to get into a mental health maze, as I'm calling it. You can use that tool to respond. It's a tool for responding to situations. And then finally, Raghava gave a little bit of a sum up around how an artist can look at the lens, can look at the crisis we're in today. So with that, we are wrapping up India. We really loved the interaction. I hope you all enjoyed it. And I'm going to introduce Anahita, who is going to be filling up a half an hour transition session before Kenya, comes on board. Anahita, is Anahita on? I'm just trying to find her. She is joining in a bit. I can see, I don't know if she's joining. So Anahita is the founder of Neural Beings and a coach. She's an organizational trainer and an international speaker. Her rigorous and experiential methodology is rooted in the Eastern contemplative traditions and continuously refined under the mentorship of leading scientists and academics in the field of psychology, neuroscience, and Eastern philosophical systems. There you are, Anahita. I was right on time. Thank you so much. Over to you. And with this, I'm signing off. I love the interaction we had today. Thank you. God bless.
Thank you so much for this generous introduction, and thank you for having me. All right, so I will be talking about suffering as an invitation for inner peace. And I would like to perhaps start by inviting everybody who's watching right now to take a moment to disengage from all mental activity and from all physical activity, and find a moment to just turn inwards. So committing to the next couple of minutes to just quiet the mind. And let's take some deep breaths together. So this is very simple. We're gonna begin by exhaling all the air out of the mouth and then inhaling deeply through the nose. We'll just do this for 3 cycles and then I will get started. So exhaling all the air out of the mouth, inhaling deeply through the nose. At the top of the inhalation, holding the breath for 3 counts and then releasing through the mouth. Sighing the air out and dropping the weight of the body as you exhale. Inhaling deeply through the nose. Holding the breath at the top for 3 counts. And then exhaling, releasing through the mouth. One last time, inhaling deeply through the nose. Holding the breath, allowing the rib cage to expand. And releasing through the mouth. Sighing the air out, dropping the weight of the body. Okay. You can open your eyes and just take a moment to acknowledge if there has been any shift in the quality of your mind or body. And we're just trying to pause between sessions for a moment. Okay. So my work is rooted in contemplative science, which is basically at the intersection between Buddhist psychology and philosophy with science. Specifically, I'm interested in neuroscience and psychology, psychotherapy. So I'm going to talk about suffering and how we can work with suffering, especially in the context of what's happening today in the world. How can we basically acknowledge our suffering and gently, without in any way dismissing it or avoiding it or suppressing it, gently enable it to transform our state and perhaps access a measure of inner peace, perhaps be able to reduce the flame of suffering and maybe increase our capacity for some mental clarity, maybe even moments of happiness, maybe even moments of deep compassion or joy. So from a Buddhist point of view, and Buddhist philosophy basically would posit that the causes of suffering are threefold, fundamentally speaking. The main cause of suffering is a fundamental misunderstanding of what reality is. So this is almost like misunderstanding how the world is by not truly inquiring into the nature of reality. And so we basically are subscribing to a version of reality, to a version of life that may not be in accordance with how things really are. So we are almost like subject to our own inner narrative, to the way that we perceive reality, when reality may be something else. Then we have this compulsion, this drive towards pleasure and happiness. We are attached to things that give us a sense of happiness and pleasure, and we're constantly trying to move away from or disengage from things that we think make us suffer or bring us pain. So like a pendulum, we're swinging between I like and I don't like. I want more of what makes me happy and brings me a momentary sense of ease or pleasure or happiness, or what we call happiness, and I want less of that which makes me suffer. And so very rarely do we ever get to sort of arrive in the center point where we can experience true, let's say, equanimity. Equanimity meaning being okay with how things are, not wanting more of what gives me pleasure and happiness, not wanting less of what brings me pain or dissatisfaction, but being almost content with the way things are. So we're in this hamster wheel, in this hedonic wheel of seeking more pleasure and avoiding pain. And this is a very shallow, perhaps, way of living that doesn't allow us to have that final moment of satisfaction that we crave. I think many of us are seeking that moment when we can have relief from this perpetual dissatisfaction with the way things are, just that moment of arriving and being okay with how things are. And that moment is very rare. In fact, I think most of us don't ever really get to taste it. So suffering, therefore, fundamentally is the sense of perpetual or all-pervasive dissatisfaction. And this is a psychological kind of suffering that I think many of us are experiencing at the moment. I am in no way denying the reality of the gross level, the obvious level of suffering, which is the suffering of sickness, which is all around us, and death. That is suffering that is unavoidable. There's a suffering of impermanence or instability, the reality that everything is changing. We can't control it. It's beyond our control because the nature of things is to be in flux. So that we can't control. But this subtle psychological suffering that I'm talking about, this all-pervasive dissatisfaction, this white noise that is constantly invading our mind, our mental space, and is constantly making us want to change how things are, that we can change, that we can work with. And that's where the mind training practices really come in handy. So it begins with, how do we transform our suffering into inner peace? It begins with a simple and courageous act of acknowledging the reality of suffering, right? Because we are pain avoiders, and to really look pain or suffering in the eye is a very uncomfortable process. We try to deny it. We try to suppress it. We try to eat sugar. I think a lot of people that I'm talking to at the moment or coaching also are telling me that they're overeating. They're buying all kinds of really strange candies and chocolates and baking a lot, which is all wonderful. But I think at the end of the day, we have to question our motivation. Are we just craving a momentary sugar high or a momentary cessation of this discomfort that we're experiencing, psychologically speaking? Or are we truly genuinely, are we really taking pleasure, and is it really giving us something of value or benefit to let's say, overeat, or to indulge in certain habits that may give us temporary relief, like smoking or drinking, for example? No judgment, but I think a little bit of too much of that may not be very beneficial. So we are seeking pleasure, and in our pursuit of pleasure, which is so compulsive, so unquestioned, so almost mechanical in a way, we rarely stop to look at what is wrong, right? To really acknowledge, how am I really feeling in this moment? And as I said, this takes courage. So looking at your own suffering, initially it will require awareness, right? An awareness to be able to just step back with a sense of objectivity. Look at your suffering, okay? And how do we look at our suffering, practically speaking? I would say, you want to disengage from activity. Maybe find a way to sit down for a moment and ask yourself, what is causing me pain or suffering in this moment? And this kind of inner inquiry, this kind of tuning inwards or empathy that is directed at yourself is actually really healing. For many of us, as children, we may not have had the skillful parent or parents that had that level of attunement to our inner reality, that may not have been able to really empathize with whatever was happening internally in us, emotionally, psychologically. So we didn't really receive that kind of attunement or empathy. So giving that to ourselves is a really powerful way to heal, basically, and to also gradually start to dismantle the suffering. So asking, what is causing me suffering in this moment? Stopping and really allowing the answer to arise, right? So it may be deep-seated sense of anxiety, a fear of what is going to happen to me in the future. It may be a mental addiction of sorts, or an addictive behavior that's making me really unhappy with myself, that's making me feel ashamed or guilty, but I'm constantly perpetuating it. It could be a deep sense of grief or sadness at the reality of what's happening in the world. Maybe you yourself have been subject to the virus, or you have known somebody who is suffering from it. You've known people that have died from it. You are losing your work. Your brother, your sister is suffering tremendously, your friend, so forth. Or you're just a compassionate human being that is, you know, really saddened by what is happening. So asking yourself, what is causing me suffering? And really allowing that answer to arise, right? So not trying to sort of force it in this top-down approach, but really allowing your answer to arise. It's anxiety, or it's sadness, it's grief, and trying to refrain from judging it. So that means having a very neutral, very objective way of relating with it, or viewing it. And once you've done that, what I recommend to do is, once you've acknowledged your suffering, and remember, in Buddhism, they say that suffering is often described as that which is hard to look at. So by really looking at your suffering, you're almost opening the door, you're opening the gateway to then transform it, right? So once you've done that, once you're clear, you've named it, you've labeled it, it's anxiety, it's sadness, you may find that just by holding it in awareness, by being able to relate with it, by acknowledging it, the burning, the pain of it might subside a little bit, right? So it might feel like, almost like it became a little bit more integrated, rather than it's something that you've been, you know, exerting so much energy to avoid or to brush under the carpet. Once you've done that, you can go even further. You can say, how is it manifesting physically? How does this anxiety or the grief that I'm feeling, this anger, maybe it's some kind of subtle anger or rage that you have towards the government, that your government, or this, you know, this social economic structure of the world, or capitalism, whatever it is. Whatever it is, see if you can see how it manifests. Ask yourself, how is it manifesting in my body? Where is it represented? And how is it manifesting? It may be a tightness in the chest. It could be a tightness in the jaw. It could be a sense of pressure in the head. It could be a sense of turmoil, or like, kind of a unrest in the abdomen, in the digestive system. It could be tension in the hips and the pelvis region. So identify it in the body. Right? So we're really granting this reality it's deserved what credit. We're saying you are there, and I take you into consideration. I am acknowledging you, and by way of doing that, you are lessening its power. So once you found it in your body, you can begin to ask yourself, how does this suffering impact my behavior, my actions, right? So you have three faculties with which you act. From a Buddhist point of view, these would be your body, your speech, and your mind, right? So every action you take with your body, every word you utter, every thought, movement of mind or thought process will have some kind of consequence. So you start to ask yourself, so this is a simple process of inquiry. How does this suffering actually impact my actions? What is it causing me to do? How is it actually impacting my behaviors, my relationships, the way I'm communicating, the choices I'm making? And then very soberly, you ask yourself, is this what I want? Do I want to engage in these actions? And are these actions congruent with the results that I want? Yeah. So if you have some kind of subtle anxiety at the moment, and your relief is to eat or to drink alcohol, let's just say, you can ask yourself, well, is eating sugar or drinking alcohol, does it actually yield the kind of results that I want? Does it actually give me the kind of relief that I'm seeking, or is it just a temporary relief? In fact, does it actually perpetuate or exasperate my suffering? In adding more shame and guilt and putting on weight and harming my health and everything else. So really being sober and honest with yourself. Are my actions congruent with the results that I want? And if the answer is no, then you may have to backtrack again and say, okay, well, good, because of things being subject to cause and effect. If something is caused, you can change the cause. So if you're not liking the results you're getting, you can go back and change the cause. So how do we do that? How do we begin to disengage from negative habits that are not congruent with the kind of results we want? and then slowly begin to engage in the kind of habits that actually produce the kind of happiness and the, the sense of inner peace that we want. So once you've done this contemplative practice and you've become really clear, you've arrived at conviction that engaging in these negative habits as a way of coping with the anxiety or with the suffering does not yield results, you begin to restrain those actions. So this is a very simple but actually difficult process of becoming so acutely aware of your mental habits, of your speaking habits, of your bodily habits, that you find yourself about to engage in them and you stop. It's really like you're flexing some kind of inner muscle. It's a muscle of restraint, and you are stopping yourself from engaging. You're stopping yourself from empowering that habit. Yeah, so this is going to lead to a lot of failures, and it's going to require a lot of perseverance and resilience and humility for you to just keep getting back up and trying again. And the fact is, you're going to have immense amount of triggers and opportunities to re-engage in those negative habits, and you will probably fail initially, but do not give up and just keep trying as you try to restrain those negative habits. Then the question really is, what do you want to cultivate? So if suffering and the kind of, the negative behaviors that arise from an avoidance of suffering, a wanting to make suffering go away, if that doesn't actually produce happiness, what does produce happiness? How can I use my suffering to actually access really, let's say, the true nature of the mind, the true nature, as the contemplative traditions would say, our essence. And that may require some practices. And those practices, again, as a Buddhist practitioner, as a student of Buddhism, I really can't begin to emphasize the importance and the value of meditation. Meditation not as a way of making ourselves temporarily feel good or to relax our nervous system or to reduce stress or increase productivity, but really meditation as a very systematic way of understanding how the mind creates suffering and how to stop those mechanisms of mind to then really disable the suffering machine, right? So for that, we must learn to let's say, have little experiences of what the mind is beneath the very shallow processes of cognition, of memory, of self-making. So we just tune inwards. And there's so many powerful meditation techniques out there. And I just, I would say that to me, what is really powerful to begin with are practices that strengthen your concentration. So anything that allows you to gain control over your attention will be of benefits, because the more control you have over your attention, the higher the likelihood is of you being happy. So try to engage in practices that really help you stabilize your attention, gain control over your attention. And then as you gain control over your attention and you're able to, for example, focus on the breath for longer periods of time, you may find that the compulsive habits of the mind may start to slow down, become gently suppressed. And what may then become more revealed or more apparent may be states of clarity, states of peace, states of tranquility that will totally shift your state. That's really as simple as it is. It will take a lot of discipline initially to learn to gain control over your attention, but I think once that's done, you will have little glimpses, and those glimpses are transformational. So then coming back to how to work with your suffering. So we talked about identifying the suffering, labeling it, feeling in the body, seeing that how the suffering impacts our behavior and how that behavior may not actually produce the kind of results we want. We restrain that kind of those habits, that behavior, and we ask ourselves, what kind of behavior is actually congruent with the results that I seek, with the happiness I seek, with a sense of connection I seek, with the peace I seek. And that's a really beautiful creative process of intentionally and deliberately taking actions of body, speech, and mind that produce happiness. So, some of those habits may be, like I said, the meditation practices. I would say generosity. Gratitude is a profoundly powerful practice, honestly, not to be underestimated. doing short contemplation practices where you take stock of all the things that are right in your life, that are good already. Those are really powerful. So I recommend gratitude practices. I would recommend genuine, deep, authentic connecting with other people. Any kind of connection that takes you out of your preoccupation with yourself, you're obsessing about yourself and your own happiness and your own desires, will probably reduce suffering. So there are myriad ways of engaging in actions that actually produce happiness. But I would really like to emphasize for today the power of meditation, the power of turning inwards, gaining control over our attention, and little by little getting glimpses of what is our true nature, or the true nature of mind, beyond, again, those superficial cognitive processes that always are somehow revolving around the self. They're emphasizing a self. They're relational to a sense of, or relative to a sense of self. And having glimpses of, let's say, selflessness, little moments where we actually almost like transcend the self and this myopic worldview that we have, are truly liberating, and they can really sort of